everyone, and welcome to our webinar, Uncovering the COVID-19 Vaccine. I'm Mallory Tenori, and I'm Associate Director of the Knight Center for Journalism in the Americas, which is part of the Moody College of Communication at the University of Texas at Austin. I'm delighted that you've taken time out of your busy schedules to be here with us today. Thank you. Before we begin, I want to mention a brief housekeeping note. At any point you have difficulty with Zoom, you can tune into a live stream of this event on YouTube. We'll be dropping the stream link into the chat feature of Zoom so you can find them here. 1 second here. Today's webinar is being held by the Knight Center for Journalism in the Americas in partnership with UNESCO and the World Health Organization and with funding from the European Union. The webinar will be held in English with simultaneous interpretations into Spanish, Portuguese, French, and Arabic. Recordings will also soon be available in Chinese, Russian, and Hindi. We're having this webinar today because we believe journalists deserve training and resources that will deepen their understanding of and advance their coverage of the COVID-19 vaccines. For the past year, journalists from around the world have found themselves covering the biggest story of their lifetime. They've worked tirelessly to inform their local communities about the pandemic, to combat misinformation and disinformation, and to understand the science behind a disease that has now affected more than 100 million people worldwide and claimed the lives of more than 2 million people. A global immunization effort is underway, and journalists are now faced with the challenge and the opportunity to cover the multidimensional aspects of the vaccines, both locally and internationally. Today, more than ever, we need journalism that informs public opinion surrounding the vaccines and that dispels disinformation by illuminating what is true. And so we're here today because we want to give you new knowledge, new ideas and insights that you can implement into your vaccines coverage in the weeks and months ahead. Next month, we will be launching a massive open online course specifically focused on COVID-19 vaccines coverage. The MOOC will be organized by the Knight Center for Journalism in the Americas in partnership with UNESCO and the World Health Organization, with funding from the European Union and the United Nations Development Program. The MOOC will be available in English, Spanish, Portuguese, and French, and followed by self-directed versions in additional languages. Registration is going to open in February, and more information will be available in the coming weeks on journalismcourses.org. Please stay tuned for more details. And in case my mic was cutting out earlier, I did just want to mention that if at any point you have technical difficulties with Zoom, you can always tune in to our live streams on YouTube. So we will be dropping those into the chat, and you can find the links there. So I would now like to turn the conversation over to my esteemed colleague, Rosenthal Alves, who's the director of the Knight Center for Journalism in the Americas.
Hi, thank you, Mallory. Greetings from Austin, Texas. We at the Knight Center for Journalism in the Americas and the Moody College of Communication at the University of Texas at Austin are honored and enthusiastic about working with UNESCO and the WHO in another project to help thousands of journalists around the world who have been working hard to cover the COVID-19 pandemic. As the holder of the UNESCO Chair in Communication at the University of Texas and the former president of active and a very active member of Orbicom, the global network of UNESCO chairs in communication, I'm especially pleased to work with United Nations agencies in projects like this webinar, the massive open online course, or MOOC, that we offered, like Mallory mentioned, last year in the beginning of the pandemic, which later became a self-directed online course in multiple languages that can be accessible right now. And also a new MOOC that Mallory also may have mentioned, that I don't remember, but that is about to start with help from UNESCO that focus on disinformation and misinformation and how to combat it in the case of COVID-19 with fact-checking techniques. That MOOC is about to start in Portuguese, Spanish, and Guarani, the indigenous language that is spoken by most of the population in Paraguay. And now, like Mallory announced, we are about to launch another MOOC with Mary McKenna, led by this great journalist that you're gonna meet in a few minutes. So thank you very much for to everybody involved in this great project. And now I pass to my dear friend Guy Berger from UNESCO.
Hello, Rosenthal. Thank you so much for that, and thanks for your work at the center. I trust you can hear me fine. Let me speak on behalf of UNESCO then and make a few points. It's in its name, a novel virus would be by definition newsworthy. And it's also inherently an international news story. And that's why an international organization like UNESCO has got such a strong interest in this whole story. The past year should have taught the world that independent and professional journalism is absolutely vital if global society is to have early warning of the emergence of a new virus. We've certainly learned the lesson that journalistic reportage is needed not just to sound the alarm, but also to prompt practical preparedness for unfolding crises. And concerning the role of the media, almost everyone today can easily appreciate that journalists are essential to monitor the range of responses to the pandemic, essential to airing the debates on the best policy measures, essential for scrutinizing COVID-related contracts and spending, essential for giving context and explaining figures and facts, essential for exposing hypocrisy amongst public figures, and more. It's more clear than ever before that journalists also serve as society's janitors, cleaning up the disinfodemic by digging into the origins of disinformation and by informing the public about internet business models that make money out of the flow of false, misleading, and dangerous content. Telling all these kinds of stories to local audiences today cannot avoid putting the stories in the context of the international trends and the experiences of other countries. And this international dimension should also include stories of those journalists who are being jailed or attacked for doing their job in reporting this pandemic. Well, if it's not yet clear enough to anyone, all these magnificent roles of journalism we've seen over the past year, they apply equally to the coverage of vaccinations. Obviously, we're at the beginning of an unprecedented global immunization effort in speed and scale, and we need continuous knowledge about the flow and the tracking of vaccinations. We need to know about the international and local queue jumping. We need to know about inequalities because they affect everybody. We need to know about dose availability and pricing deals, which are kept secret by the drug companies, even though many of them benefit from public funds and public funded research. Today, we also need to have ongoing stories about comparative government preparedness and government strategy and policy on vaccinations, as well as stories about how vaccines are impacting on life in those few places in the world that are making progress in mass vaccinations. And finally, we need journalism that keeps track of anti-vax disinformation, that digs into it. Such disinformation is something that can render irrelevant all the complex processes that precede the moment of people actually getting the jabs. So all this is why UNESCO supports this program that's being executed so well by the team assembled by Prof. Rosenthal Alves, in the framework of UNESCO's European Union funded project, which we have the hashtags coronavirus facts, and part of our work in addressing the disinfodemic about COVID-19. And these remarks I've given are also why UNESCO is working closely with the World Health Organization to support journalism as an immunizer to the infodemic. And that's why we look at you, the participants in this program, to make the most of these knowledge resources, to become part of a strong community of expertise, sharing information and insight and tips amongst each other, and serving the public as is so desperately needed at this historic and tragic juncture. All this is also why we will continue to engage with you, Prof. Rosenthal and his team, as well as UN Development Program, UNDP, for the forthcoming massive open online course on vaccines that will launch in March. So in wrapping up, all this is part of humanity's quest for sustainable development, for human rights and freedoms, and international solidarity. You, the journalists, are today's lead agents of transparency. You are the creators of that rare and precious commodity of verified information in the public interest. The more expertise you have at your fingertips, the better you will be able to fulfill your historic mission. And UNESCO is super pleased to support you in this trajectory. Thank you.
Good morning, good afternoon, and good evening wherever you are. I'm really pleased to connect with you through this webinar organized by our partners UNESCO and the Knight Center for Journalism at the University of Texas at Austin. 2020 was an extraordinary year for the world. I experienced 2020 through the lens of a former journalist and as the Director of Communications for the World Health Organization. WHO is thankful to you for your partnership in getting evidence-based information out to the public during a fast-evolving and really dire pandemic. In 2020, we at WHO reached out to you in many ways, through more than 130 media briefings, through our various social media and traditional channels, and through many learning platforms as well. This year, 2021, I'm challenging WHO and my team to be better and to do better. As countries roll out vaccines, we will depend on your reports, journalism, from the ground and from around the world, to help us at WHO and in the global health sector, to help us listen to the needs of the public, your audiences. We at WHO promise to do our best to provide credible information to you in a timely, understandable, actionable format so you can reach the public. The pandemic still has a long way to go. Intense transmission is continuing, and as you know, it's putting enormous pressure on hospitals, intensive care units, and health workers, as well as all the other frontline workers who make the world go day in and day out. Vaccines are going to be a critical new tool in the battle against COVID-19. Indeed, they are already being rolled out, as you yourselves are reporting. But of course, we have to make sure they get to all health workers, all elderly, all vulnerable people everywhere. So safe and effective vaccines will be a game changer. But it doesn't mean we can let down our guard. For the foreseeable future, we have to continue wearing masks, physically distancing, ventilating, avoiding crowds, washing hands, and all the other measures that we know work. And I know these are hard messages to get through. They're not what you want to hear, but they will save lives, they will save livelihoods. We have to keep going. As vaccines roll out, we have to continue with these measures around the world. As you may have heard from our press conferences, or as you've reported yourselves, we at WHO are working hard and fast with countries to help them set up their public health systems so that when COVID-19 vaccines come, they can actually deliver them and get shots in people's arms. So this includes supporting countries as they develop national plans, as they prepare for regulatory review of vaccines, and as we do in our operations as well, training health workers to administer the jabs, preparing supply chains to get the vaccines to the locations, including those that need refrigeration, working with communities to educate them about vaccines, why vaccines work, how they work, and tracking any adverse events. Pandemic fatigue has set in, so we must ensure that our information cuts through the clutter and the fatigue and empowers the public to make the right choices for their health and safety. We need your support, journalists' support, to get evidence-based information out, to counter fear and rumors. We will work closely with you to quickly counter misinformation and communicate science and uncertainties. Now, all of us know that the biggest global challenge is inequity. COVID-19 can't be beaten one country at a time, as I said earlier. The epidemiology shows that no country will be safe from the fallout of the pandemic until all countries are protected. It's also an economic imperative. There will not be a proper global economic recovery, as many studies have shown, until we stabilize the most vulnerable in all countries and then go from there and eventually vaccinate larger and larger swaths of the population. So in essence, there cannot be a recovery from COVID, there cannot be an economic recovery, and we cannot look ourselves in the mirror and know we've done the moral thing if half of the world is hamstrung, if half of the world is deprived of COVID-19 vaccines, as well as tests and therapeutics, by the way. So these are important messages that we'll be encouraging you to write about. And I just want to encourage you to come to our media briefings, to contact us on our various channels, and nudge us if you don't hear from us right away. We're super busy. We're a small team. So if you don't hear from us right away, just reach out, continuing reaching out, and don't give up on us. Some days we are flooded with media inquiries. I just want to conclude by saying that this webinar and the MOOC that will follow is part of our commitment to support journalists and journalism around the world. And my hope, my sincere hope, is that together we'll get the messages of science, solutions, and solidarity to the public, and together save lives in 2021 and beyond. I thank you.
Hello, everyone. If you're just joining us, I want to quickly let you know that we are streaming this webinar onto YouTube in English, Spanish, Portuguese, and French, and Arabic. So if you have any technical difficulties with Zoom, you can tune in via YouTube, and you can find those links in the chat feature of Zoom. So now I'd like to kick off our first panel of the day, which will feature a talented group of international journalists who have been closely covering the pandemic. Our moderator today is renowned health and science journalist Maren McKenna, who's a senior fellow at the Center for the Study of Human Health at Emory University. Maren, thank you so much for being with us today.
Good morning. Good morning, good afternoon, good evening to all the people who are joining us here on Zoom and also on the YouTube version of this. We're so grateful that you're here on this incredibly important day for vaccination when two vaccine companies have announced their results on formulas that will be particularly important to underserved areas. Shall I introduce our panelists, Mallory, or will you?
Go ahead.
So I'm joined by an amazing group of journalists to discuss what they have been doing for the past year in covering the pandemic. We have Andre Biernath from Brazil, Kai Kupferschmidt from Germany, Federico Cuxo from Argentina, and Yves Siama from France. And all of them have just connected. And we're going to start with my asking each of them to tell us what they've been doing in covering the pandemic, and particularly what they've been doing to cover vaccination in their countries or in their areas, but the areas where they live and their areas of coverage. Good morning, gentlemen. Andre, let's start with you.
Hi, Marin. Good morning, good evening for you, for everyone who are watching us. First of all, it's a pleasure to be here with you. I think we can have a great discussion. So my name is Andre Biernath. I'm a health and science journalist from Brazil. I work in this area for 10 years in a magazine first, and now I am a staff reporter of the BBC Brazilian service. And I'm also the president of the Brazilian Network of Science Journalists. And I have been following the pandemic since the beginning, in January of 2020, when I started doing the first articles about the new coronavirus. And I have written and made videos about all the advances related to vaccines. And I think my main objective as a journalist is try to gather and mix the scientific information, the published articles, the latest data information about the vaccines with the simplest and most common doubts, questions that people have about the vaccines. So thank you very much for the opportunity.
So let's stay on the same continent for a moment. Federico, tell us what you've been doing.
Hi, Marian. Thank you for having me. It's a pleasure to be here with you. Well, I'm an independent science journalist from Buenos Aires, Argentina. I'm also the board member of the World Federation of Science Journalists. I write for regional newspapers such as La Nación, also regional for Latin America like Le Monde Diplomatique, and for some news outlets in Spain like Agencia 5 and El País. And I've been covering the pandemic since the detection of the first cases in January. And in the case of the development of vaccines is the beginning of the clinical trials in March. I publish daily reports on my social networks, trying to bring some clarity in the middle of everyday chaos. I interview specialists on the subject, and especially what I do, I write features, long features, where I'm trying to include the perspective from history of science, the history of vaccines, and the history of vaccine campaigns, and also to write about the geopolitics of vaccination and the cultural aspects of vaccines. And I think it's really important. It's not only a matter of science, it's a multidimensional subject.
Thank you. Let's leapfrog the Atlantic. Good afternoon, Yves. Please introduce yourself.
Hi, Marian. Thanks for having me. Hello, everyone from France. So I'm a freelance journalist. I cover health, but also life sciences in general for various French outlets. I work on many things, not only COVID, but I've covered COVID quite a lot, obviously. And now I'm writing various stories about vaccination issues, including an investigation on how the virus is going to evolve once we have several vaccines out there, which is a big question for the future. I'm also president of the French Association of Science Journalists, and this leads me to read a lot of what my colleagues are writing in this period, also because journalism has been attacked sometimes for the way it covers the pandemic. Sometimes it was rightly attacked, sometimes not. But we try to follow that with my colleagues, and we've been caught up in these discussions. So I try to follow that closely too.
And finally, Kai, good afternoon to you too.
Hey, Maren. Yeah, I guess, while I'm based in Berlin, I work mostly for Science magazine in the US. So I think my coverage tends to have a bit of more of a global point of view. I wrote my first story on 9th of January, I think, last year. So it's been more than a year of covering it now. Obviously, lots of things to cover, but really the vaccines have kind of, the vaccines and the variants of the virus that we're seeing pop up in places around the world have really become the main topic for me. So there's this weird disconnect sometimes, and I'm sure we're going to have a chance to talk about that later. But you know, everybody in Germany, I see my local kind of, you know, the news in Germany talk all about how many people are we vaccinating here? Why isn't it going faster? How do we make sure more people are vaccinated? And at the same time, I'm talking to people around the world where there's no vaccine, and there's no, you know, in the foreseeable future, there probably won't be any vaccine. So, you know, this is something that we also have to navigate, apart from all the other things we have to navigate as science journalists in this pandemic. I think it's trying to, you know, to have the local perspective to a certain extent, but also see the bigger picture, because it is still a pandemic, a global event, right?
So thanks all for introducing yourselves. It occurs to me that I didn't actually introduce myself, which was a little rude of me. So hello to everyone watching. I'm Maren McKenna. I am a correspondent for Wired magazine in the US, and I write for a number of magazines here. Like everyone else on the panel, I've been covering the pandemic since the beginning, and now I'm writing about the science and logistics of the vaccines. I'm also a senior fellow of the Center for the Study of Human Health at Emory University in Atlanta in the States. So I'd like to begin by talking about what all of you are seeing and reporting on with regard to the vaccines, what's available, what's been authorized, what challenges you're perceiving in your coverage areas and also globally in this story. And Kai, since you have the global perspective, you want to start us off?
Oh, wow. Yeah, where to start, right? I think this is an unprecedented situation in so many ways. And when we talk about vaccines, I think, you know, for us as science journalists, of course, there's just the sheer amount of information that's coming out. I mean, I was yesterday night at like 10 p.m., I think my time, I was listening to the Novavax results. Today, I was listening to a press conference on the Johnson & Johnson results. Just now, while we were talking, the European Medicines Agency granted, you know, its approval to the AstraZeneca vaccine, including for people over 65. I mean, all of these are ongoing stories, right? And you look at these, and you have to look at the data that's there. So it's just, you know, it's a lot of information that's there that you have to put into context, and then what you have to communicate to people is the fact that for the first time, really, we're going to be in a situation where you have a lot of different vaccines with, you know, different mechanisms, with different data on, you know, how well they work, taken at different time points in the pandemic, which means you can't even compare it necessarily, and different availability around the world. So all of that means that this is very different. We used to have a conversation about, you know, measles vaccine. Why should you get it? Or, you know, what are fears that people have why they might not get it? Now it's, you know, what vaccines are there and how do they work, and, you know, which one is the best in a way. So it is a very different conversation that we're having to navigate as science journalists, and that the public has to navigate. And I think that's it's going to be a learning experience for all of us.
So I'd like to ask the rest of the panelists, since your coverage is more directed at regions or your particular countries, what the vaccine achievement and debate looks like for you. Yves, what's the situation in France?
So France is well known for being very skeptical about vaccines. I think we're almost the worst in the world on that issue. So the government planned for a rather slow rollout. I think they were scared of this skepticism and wanted to go slowly. So at this point, we have 2.7 million doses have been delivered to France, of which half has been injected already, which is less than some of our neighboring countries, but of course, as Kai rightly pointed out, more than many other places in the world. But what's been really interesting is that opinion has shifted very, very fast towards an approval of the vaccines. I think last week, the figure went up by 15%. So this really leads me to point out that we're going to have big opinion shifts, and they will not necessarily be in this direction. Because if we have incidents, if we have disinformation, if we have a mix of problems, then opinion can move very fast. But for the moment, in France at least, the problem is much more the rollout than the acceptance of the vaccines. And this is not necessarily what we were expecting.
Federico, what does the situation look like where you are?
Well, we are looking how other countries are vaccinating in the internet, mostly because, as you know, Latin America, and Andre knows it as we do, we don't have many vaccines. The region has been neglected or ignored by pharmaceutical companies, despite the fact that countries like Argentina, Peru, Chile, were the place where many of these clinical trials of this vaccine have been carried out. The only two countries that have already begun with a campaign of vaccinations are Chile and Argentina. For example, here in Argentina, although we have authorized three vaccines, like the Sputnik V vaccine from Russia, the Pfizer vaccine, and the AstraZeneca vaccine, we only have a few amounts of doses from the Sputnik V vaccine. Chile yesterday received 2 million vaccine from the Chinese vaccine, from the CoronaVac vaccine. So the situation is really bad in terms of that the vaccination campaign is really slow, and we are waiting for vaccines that they don't arrive yet. So that's the situation here.
Andre, what about in Brazil? Certainly, the world has given a lot of attention to the city of, am I saying this correctly? I apologize in advance, Manaus. About Manaus, thank you, about the recurrences there when it seemed like things were going quite well. What does the vaccination situation look like there?
Yeah, and to date, Brazil has already approved 2 vaccines, CoronaVac from Sinovac in China, and Covishield from Oxford and AstraZeneca. The problem in Brazil in this moment is the pace of the vaccination, because we have 2 big producers of vaccines in Brazil, the Instituto Butantan in the city of São Paulo and the Fundação Oswaldo Cruz in Rio de Janeiro. And we have around now, to date, around 8 million doses. But the pace of vaccination is really slow. We had around 1.5 million people vaccinated until yesterday, but the capacity of the Brazilian public system to vaccinate is really wider and bigger. Some sources of the Ministry of Health say that we have the chance to vaccinate around 900,000 or 1 million person per day, and we are vaccinating around 70,000 or 80,000. So we have to speed up with the doses that we already guaranteed.
So an interesting thing in what everyone's saying, and this is certainly true here in the United States as well, is how slowly vaccination is proceeding. And I'm wondering what all of you are hearing in terms of the appetite for vaccination among the populations where you are, and also what the explanations are for why vaccination is proceeding so slowly. Andre, we'll just go straight back to you.
Okay, I think I'm writing an article about that, and I think there's a problem with the communication, because there's a challenge to say to people who are being vaccinated when they have to go to the hospitals and the places where the vaccines are being delivered, who will get the first doses, and most importantly, when to return. Because, for example, in Brazil, you have CoronaVac that the second dose is 14 or 28 days after the first. And we have Covishield that it's 1 month or 3 months after the first dose. So I think it's a communication challenge. And we shouldn't have, here in Brazil at least, a good plan of communication, a public communication about the usage and the campaigns of vaccine for COVID-19.
Federico, do you perceive these same problems in the rest of South America?
Yeah, well, the main problem is perhaps the difference with Brazil or other countries that we, as I said before, we don't have vaccine. We don't have the offer of vaccine. We were waiting some vaccine from Pfizer that they never arrived. And so we only, countries like Bolivia that yesterday they received 2,000 doses from the Sputnik V vaccine, we rely on these vaccines. As you know, they haven't published the phase 3 results yet. So that's the problem. The only ones who are getting the vaccines are the medical staff, and we are waiting for more vaccines, but that's the main problem in the region.
Yves, what do you think is the situation in France? I was so interested to hear you say that people are reducing their skepticism, but has that speeded up the vaccination campaign?
I mean, I think the appetite is quite strong now for vaccines, and what's holding back vaccination is that we have not received enough doses. No vaccines are produced on French territory right now, so we're dependent on imports. I think even the logistical problems have been more or less solved. At the beginning, the rollout was really slow and there was a lot of criticism of the government, but at some point we reached 130,000 injections per day, and that sounds like a reasonable speed, and it was probably likely to go up. And now we have canceled some rendezvous for people because we can't provide as many doses as was hoped.
So I want to turn to this question of vaccine supply, and I'm particularly interested, Kai, is there anything that you can say about the tensions within the EU or recently ex-EU members about essentially the vaccine nationalism, about what vaccine trade is going to look like across borders?
Yeah, I mean, it's an interesting example, isn't it? So this morning, I think we got the contract, well, most of it, I mean, parts of it are redacted, but we got the contract between AstraZeneca and the EU Commission, which, you know, in general is something that maybe people have to realize is, and it's a job for journalism, I think, like these contracts tend to be secret, and I actually think they shouldn't be. And I think it's part of our job as journalists to maybe try and, you know, get as much detail as we can on what these contracts actually look like, you know, how they come into being and what they say. So it's an interesting example because there's basically a fight now about how to interpret the meaning of some clauses in the contract, and whether the EU should get more vaccine, you know, even if the vaccine produced in the EU is lagging, you know, should AstraZeneca send some of the UK produced vaccine? It's an interesting question, but again, like I'm always amazed we're having these debates within this, you know, within this sphere of Europe, and then it's like, oh, but this is so unfair, you know, and you could hear the EU commissioner say something like, you know, we expect fairness from AstraZeneca and stuff. And it's this very interesting definition of fairness, because it's only fairness within a very small part of the world, right? I mean, if we're talking about fair distribution, what does that really mean? I mean, you know, is the way that we've organized this even the best way to do this? You know, the fact that some countries have, you know, bought hundreds of millions of doses, many more than they have citizens, and might at the end, you know, donate a lot of it, and other countries don't have a chance to actually buy any doses. So I'm always like, you know, it's fascinating political theater in a way, and it's an interesting thing to look at. But at the same time, if you broaden it out, you kind of have to shake your head sometimes and go, you know, this feeling of moral righteousness that some of the actors, you know, seem to have in this drama is really one that's, you know, not warranted, I think.
Well, certainly the situations that the four of you are sitting in are perfect examples of the differential of supply and equity across the globe, comparing the EU to what Federico is describing in South America, for instance. So we're starting to get questions from people who are watching, and many of them are about a topic that I wanted to ask you all about already, so I think we should move to it right away, which is the question of misinformation and disinformation regarding the vaccinations. So I'd like to hear from all of you how this is arising for you and in your coverage areas, what you think we need to be doing, what the biggest concerns are from people who are your readers or viewers, and if you can distinguish between legitimate concerns and weaponized disinformation that we need to push back on. Eve, I don't think I've started with you yet, so let's start with you.
So for the moment, we haven't had any blatant disinformation on the vaccine issue. There's been some skepticism, of course, and some arguments that don't really, in my opinion, hold water for now. But basically, what strikes me is that people ask the right questions. They want to know what the side effects are. They want to know if the people who have been vaccinated really get protection. And we have to answer these questions if we want to convince them. And I mean, we just have to convey the truth to them. Our job is not necessarily to convince them. So I think we've had a lot of disinformation in the first part of this pandemic, and this disinformation very often surges suddenly and in an unpredictable manner. So I'm pretty sure that we're going to have these things sort of shooting in the scene with wild claims by strange people, and we will have to debunk that. I think 90% of our job is just giving the right answers to the smart questions that people are asking us and to the things that they want to know. And then, of course, we'll have to debunk whatever comes along, and I'm sure stuff will come along.
Federico, what does this look like in South America? What's the situation with disinformation there?
Yeah, I think that the biggest problem is that the hoax and the fake news and the misinformation that don't only circulate in social networks or in WhatsApp. In Argentina, for example, the vast majority of the media opposed to the government are developing a strong anti-vaccine campaign. And not only against vaccine developed by Russia or China, also on all types of vaccine, especially they pay a lot close attention to the adverse effects of vaccine, mostly because the media know that fear attracts clicks. And in this time of the crisis of the press, this is very important. So this also explains why so many big media outlets publish so many conspiracy theories or articles about the relationship between astrology and the pandemic, something like that. So I think that among the most important challenges in vaccine communication is combating this kind of disinformation campaign, especially produced by political journalists who do not know to cover science issue, and they take advantage of the uncertainty to impose their political agenda, mostly against the government, that the governments are trying to bring these vaccines. So I think that's the main problem. And also what I see is that many science journalists are being marginalized in the coverage of the vaccine and the pandemic, mostly because we try to bring information based on evidence. And many of these journalists, these political journalists, they bring opinions without any kind of expertise in knowing how to cover these issues.
What you were saying resonates so much with me here in the United States. My science writing colleagues and I so many times said in the past year, why are the political journalists covering this at the level of White House and Congress? Why are science journalists not being sent to these briefings when we could illuminate them? So, Andre, do you have a thought about this from the Brazilian situation?
Yes, of course, I totally agree with Federico, but I think the situation in Brazil is a little bit more sui generis, because some of the disinformation and misinformation is coming from the government. That's a really bad situation when they send messages saying the Chinese vaccine is not good, or the Chinese virus and something like that. And during the last weeks and the last months, we heard absurd stories about vaccines with microchips that spy people, or vaccines turning people on alligators, for example. It's bizarre, but it happened here in Brazil. And I think that as science journalists, of course, we have to make stories and articles debunking this kind of information that it's bizarre, but incredibly some people believe it. And of course, as Yves said, I also think we have to respect and answer the doubts of people. Sometimes they are not so bizarre as turning and then vaccines turning people to alligators. Sometimes it's about side effects or something that we have the opportunity to explain it and to explain the scientific process, so people are more calm and rely more in what is being done with the vaccines.
So Kai, again, of everyone in the panel, you have the most global point of view, I think. What does this battle over misinformation and what people really need to know and disinformation and when it's weaponized for trade or political reasons, what does this look like from where you sit?
What does it look like? So I think the whole pandemic has been, exacerbated by the fact that we are battling this second pandemic at the same time, right? This infodemic or whatever you want to call it. I think when we talk about vaccines in particular, one of the problems we have is that there is this perception, I think, of vaccines also as a kind of panacea, as something, a silver bullet, something that's going to solve everything. And even if there's not targeted misinformation about the vaccines themselves, there is still this kind of idea that the vaccines are going to solve everything. And I think it's very, very hard to communicate to people, especially at the moment, that the vaccines are only going to be as powerful as we let them be by keeping variants from evolving and all of these things. So I think it's not just about people, sowing doubts about whether the vaccines work, but also people with certain interests not getting the message that you actually have to do other things at the same time. And there is one thing I think that helps us with the vaccines a little bit, and that's the fact that unlike, say, with drugs, there's not a hydroxychloroquine of vaccines. And you don't have the problem that you have vaccines that don't work, just kind of being suggested by random people. So that at least you don't have. But when it comes to debunking information, again, a lot of us science journalists are used to doing that from a perspective of being able to look at years of data. When you take the measles vaccine, we've all probably written about MMR, but you have a whole story there, years and years of data that you can point to. There are a lot of legitimate scientific questions about these new vaccines, and you really have to strike a balance when communicating this between what Yves rightly said are absolutely valid concerns about it, and being able to communicate the fact that answers are still uncertain to some of these questions, and not giving people kind of false certainty while still explaining why for the moment these vaccines might make a lot of sense.
So that's a really important point, and I just want to ask the rest of the panel to respond to that. This question of that we are still only a year into this profound global challenge, that as many, tens of thousands of papers as have been written in the past year, we still only have a year's worth of research, and we only have about 6, maybe 8 months for the earliest trials worth of data of vaccines in human beings. So I'm curious how, Yves, Andre, and Federico, how are you communicating to your audiences this question of science is an evolving process and science changes? Is this a particular challenge for you? I'll pick one of you if you like. Federico, how about you?
Yeah, I think as Kay and Andre said before, the importance of telling stories about the process of science, telling stories about rejected papers, telling stories about even about fraud. I mean, not only, I think one of the biggest problems in this coverage of the pandemic, and even in the science coverage, is not to follow the hype. Because every day we wake up with another press release from one of these big pharmaceutical companies saying, wow, the efficacy is 92%, right? So we have to know that these companies are, they are interested protagonists in these pandemics, right? So we also have to make those questions. Where is the data? Where is it being published? Has this paper been rejected? Is it a preprint? So I think we have to make these questions. We have to, and also one of the biggest problems I see in the coverage of the pandemic in Latin America and Argentina is that many journalists, they don't care that the scientist is the specialization of the scientist. For example, as we all know, it's not the same to interview, I don't know, a food doctor to talk about the pandemic, right? You have to find the right source. So some journalists who are not really working in science issues, they only care that they're a scientist, right? So we have to choose the right sources to give the right information.
So the lessons of what journalists should be doing as we move forward is going to be my last question, and that's really important. So put a pin in that, because I'm going to come back to it. But this question first of how we're communicating, how science works, and the challenges inherent in that. Andre, do you have any thoughts about that?
Yes, I think we, I don't know in the entire world, but here in Brazil, we are very bad in communicating uncertainties. To show that science don't know everything, and sometimes the process is still ongoing and can change the information. I think another problem that we have to battle is to focus and follow the consensus in a certain aspect, because sometimes the articles interview a person that is favorable for a medicine, for instance, hydroxychloroquine, and another that say it doesn't work. So it creates a false equivalence that when you see the consensus of the specialists doesn't exist. So I think it's another problem that we have to battle during the next weeks.
So Yves, I'm especially interested in your point of view on this, since you are in the country where hydroxychloroquine was first touted by a French doctor. This question of competing claims in science, what's true, what remains to be discovered, what gets contradicted. What are your thoughts on this?
That's a really tough issue, especially because very often the problems come from within the medical community or even within the scientific community. We have lots of people out there who have doctorates now and who make really wild claims. So dealing with that is not easy, but what impresses me, however, is that if you take the whole spectrum of the media, a lot of progress has been made. And now the disinformation is sort of concentrated on a few identified medias, and people go there because they know they want some alternative information. But I would say that on the whole, the media scene in general has made progress, and it's worth pointing this out because it's an important aspect of the general situation.
So we have about 5 minutes left in this panel. And what I'd like to do now is for each of you to sort of extract some lessons from what you have observed so far and what you've been doing over this past year for all the other journalists who are listening, who may be newer to this topic or less experienced than you are. Yves has already mentioned being careful about who we speak to in the medical profession, and Federico has been very clear that we need to be careful what sources we choose and make sure that they are trustworthy sources. But I'm going to go around and ask each of you what your top several lessons are for other journalists as we move forward. Andre, I'll start with you.
Okay, I think the main lesson, as Federico told, is not only to, is of course here the specialists, but I always try to not only listen to doctors, but to listen to other specialists of other areas, such as the nurses, the epidemiologists, the virologists. I think they can enrich a lot our articles and give points of view that are interesting and diverse. I think sometimes we stay when we rely a lot and only on doctors and not in all the other areas that knows a lot about the virus or the pandemic. I think this is a good lesson. And of course I have I think we have an obligation as journalists to debunk the misinformation, the fake news, and try. And I think that the best way of doing that is trying to explain and show how science works and how is the scientific process to reach some information, some knowledge.
Great, thank you. Federico, I'll come back to you. Lessons for the other journalists watching.
Yeah, I mean, I've specialized in history of science, that because I'm so interested in history. I think that the historical perspective is important to understand the present. For example, what happened in previous pandemics, what happened in the polio, with the polio, what happened with HIV, another pandemic that's it's already there, right? I'd like to do is I'd like to mix between having a local view but with a global view. What's going on in the countries that surround you? What's going on in the other part of the world? As Kai said, this is a pandemic. This is a global event. We try to cover the issue not only from your bubble, try to cover the issue globally. And also pay attention to the geopolitical stuff, as many others said, the vaccine nationalism, the vaccine hoarding. And also try to find sources, not only scientific sources, try to talk with sociologists, try to talk with other kind of sciences, because the problem always is to find a different point of view to try this subject. So I think you have to have an open mind, because as I said before, this is a multidimensional problem.
Yves, what are your thoughts, lessons for other journalists as they move forward in covering the vaccine campaign?
So I think the vaccine issue is really a very good tool for journalists to get at the heart of how our societies work, and about our values, in fact. So I think we must be careful not to limit ourselves to a narrowly technical coverage, like how many % of the people are we going to get cured? And of course, there's a temptation to do that when you're a science journalist, because you have all these facts out there and you think your job is to check the facts. And of course we have to do that, but we have to ask also questions about, intellectual property rights. For example, is it normal that these companies who have sort of won the race keep the rights on their vaccines? Are these companies the heroes of tomorrow? Everybody is going to congratulate them and be so grateful for what they have achieved, but how much of this was achieved with public research? And if these property rights were shared, maybe we could get many more vaccines out on the market very quickly. So there are things to think about there. And also, of course, who gets the vaccine in priority. That says a lot about our societies. And I'm not only talking about southern countries, I'm talking even within our societies. How about people in prisons? How about, first line workers? So I think everybody agrees the world is going to change with this pandemic. So it's also our job as journalists to ask the right questions and help it maybe change the right way.
Kai, I began this panel with you, so I'll end with you. 1 minute on lessons for other journalists as they move forward.
Oh, wow. I think I could spend an hour on the lessons that I've learned, but let me make 3 points. So I think one of the most important thing is that it's okay to say we don't know yet. There are so many questions that come up. Everybody can see the questions. And very often our job as science journalists is to say, listen, we don't know yet, but here is what scientists are doing to try to find out. This is how they are going to find these answers. And that way you actually build trust with people. And when you then come back with answers, they might actually trust you more than they would have. The other thing, it's hugely important to keep an open mind. I have seen this over the year play out with many journalists. It is so easy to get invested in a narrative. It is so easy once you've written that hydroxychloroquine works or doesn't work to then kind of try to almost defend your own pieces that you've written before, to defend your own views. I think it's really important to keep an open mind. Sometimes we will have been wrong with what we assume early on. Stuff changes. We're all learning in this pandemic. So just take your reader or your viewer or whatever along on this journey. They are learning with you, ideally. And the last thing, specifically on the vaccines don't save lives. Immunizations save lives. So we need to remember when we talk about the global rollout of these vaccines, that it is about getting these vaccines to people, and different vaccines have different challenges. So like Eve said, don't stick with the, whatever percentage a pharma company has shown in its trial works. It's about real world effectiveness. It's about what we can actually do to get these vaccines to people. And I think that has to be a huge part of our coverage this year.
Thank you so much. And thanks to all four of you for the amazing wisdom that you shared in this panel. All of the journalists I know who have been watching this from around the world are really going to benefit from this. Thank you all for watching. That's the end of our first panel, and we will be back in a couple of minutes to talk about the science and later on today, the logistics of COVID vaccination.
Hello again, and thank you so much for being with us here today. I'm Mallory Tenori from the Knight Center for Journalism in the Americas at the University of Texas at Austin, and so glad you're here. If you're just joining us, I wanted to let you know that we are streaming this to YouTube in English, Spanish, Portuguese, French, and Arabic. So if you have any technical difficulties with Zoom, you can tune in via YouTube. And the links to those YouTube streams are available in the chat portion of Zoom. And if you want to listen to different interpretations on Zoom, just click on the interpretation button and you can select the language that you want. So we are now going to begin our second panel, which will explore key scientific developments behind the vaccines, with an eye toward helping journalists understand the global significance of these developments. I'd now like to turn over the conversation to our moderator, Marion McKenna, who will introduce our panelists.
Good morning. Thank you, Mallory. Thanks everyone for being with us at this fantastic webinar on the journalism, the science, and the logistics of COVID vaccination. I'm thrilled to introduce this second panel. We're going to dive deep into the questions of science surrounding COVID vaccines. They are Dr. Angela Rasmussen, a virologist recently of Columbia University and on her way to a new appointment at the University of Saskatchewan. Dr. Purvi Parikh, an immunologist with the Allergy and Asthma Network, and Dr. Ana Maria Henao Restrepo, who's the unit lead with the WHO's Health Emergency Preparedness and Response Unit. Thank you, all of you, for being with us today for our truly global audience. People have checked in from all around the world to hear this. So I'm going to ask each of you first to introduce yourselves, tell us a bit about your work, and tell us particularly what your role has been this past year in the pandemic, and also what your role is now with regard to the effort to get out COVID vaccines. Dr. Rasmussen, I'll start with you.
All right. Well, thanks so much for having me, everybody. And it's great to be here with you, Maren, and my fellow panelists. I'm Angie Rasmussen. I'm a virologist. Up until November, I was at Columbia University's Mailman School of Public Health. Now, as mentioned in the introduction, I am on my way to VIDO Intervac, which is a vaccine research institute at the University of Saskatchewan. And my role during this pandemic is not only am I doing SARS coronavirus 2 research myself, looking at the host response to infection, which is what I study. But I've also been very active in terms of communicating with the public, just because this is such a profound, this is having such a profound impact on all of us. I think it is really important to be able to communicate directly with the public about the emerging science, given that there are so many unknowns, as well as with journalists who are trying to better communicate that to the public as well. In terms of the vaccines, I am not involved in actually any vaccine development for any particular vaccine, but I do think that the vaccines are the long-term solution to this crisis that we're all in. And I think that what I can do is help the public understand the vaccines a little bit better, understand what the data says about them, celebrate the achievements of developing these vaccines in such an expeditious manner, and also advocate for making sure that there is global vaccine equitable access to immunizations around the world, because a pandemic by definition is a global crisis, not a national one. And so it's really important that people are not only on top of the science that underlies the vaccines, but also making sure that we can get them out there to everybody who needs them.
Thank you so much. Dr. Parikh, I'll go to you next. Your role in the pandemic in the past year and your role as regards the vaccines rolling out.
Yes, thank you. So I'm Purvi Parikh. I'm an immunologist as well as an allergist, and I practice in New York City, and I'm on faculty at NYU Langone. And there I've been working in their vaccine center, actually on both the Pfizer vaccine trials as well as the AstraZeneca vaccine trials. So I have a unique perspective in, the development, the clinical trials, kind of from day one, whether it was back May of 2020. But aside from that, throughout the pandemic, I've been very vocal in media as well as social media to kind of really help get out accurate information now with the vaccines, but even prior, and helping to dispel myths, both from an immunological standpoint, but just, generally to help people understand the virus. And I feel like that is very, very important, because as much of a pandemic, this has also been an infodemic, and much of what we hear of is not correct, and there's so much hysteria and fear and anxiety. So I think it's really important, to have people like Dr. Rasmussen or other panelists to really help convey accurate information and make sure people understand the science behind it and the data behind it, especially given the amount of politicization that we're seeing with the vaccine rollout. So currently, besides the clinical trials and kind of the public outreach that I've been doing, I've also been working, locally with various governments to help them improve the rollout as well.
Thank you so much. So both of you are currently in the United States, but we'll say that you represent North America. And so for the global perspective of this, I'd like to go to Dr. Restrepo, and please excuse me if I am pronouncing your name incorrectly. And we'd like to hear a bit about, from the WHO perspective, what this coming vaccination campaign looks like and what your concerns are about the vaccination program.
Yes, so my name is Ana Maria Henao Restrepo, and I work in the emergency program of WHO, as you mentioned. And I just want to say that for us, there are 3 dimensions to this conversation. One is the scientific dimension, and we have good news demonstrated that there are a lot of collaboration among the scientific community, lots of tremendous progress, having several vaccines being evaluated and available in a record time. The second part is the other control measures that are very important and equally important as the vaccines get rolled out. All what we have learned about the epidemiology of the virus, the ways of transmission, that has helped us to identify the control measures that will prevent the virus from moving from person to person. And the third point, and the reason why I'm here and normally don't go to the media, is because I think it's important for the public and the journalists to understand that it's true that we are in front of a tremendous challenge, that this is a unique experience for all of us, being working in science or public health or being just a common citizen, but that there is so much that everybody can do. So yes, it's true, the vaccines will come and help to protect us. Yes, it's true, governments are taking measures to reduce the transmission of the virus, but the citizens, the people, can do so much more, and perhaps it's important that now we underline the role of individuals and communities in controlling this virus.
Thank you so much for those opening remarks, all of you. I think it would be useful for our global audience if we could talk for a moment about the actual scientific basis of these different vaccines. And of course, since a couple of new vaccines, not on the mRNA platform, were announced their data just in the past 24 hours, that's tricky because we have a few things to talk about. So I'm going to go first to Dr. Rasmussen and then to Dr. Parikh, since you were involved in the trials, and see if there's anything that you can say that our listeners who are mostly not scientists need particularly to know about the science of these vaccines. Dr. Rasmussen first, please.
So maybe it would be helpful for me to just very briefly summarize what the differences are between the different vaccine platforms and why we need to have multiple vaccine platforms to deal with this crisis. So the mRNA vaccines, which everybody in at least the US knows about pretty well, and people have heard about, pardon me, are basically a piece of messenger RNA, which is essentially instructions for how to make the spike protein of SARS coronavirus 2. And that is what we call the antigen, the protein that your immune system will respond to when you're given the vaccine, and then should you be exposed to the virus later on. The adenovirus vectored vaccine, such as Johnson & Johnson and AstraZeneca vaccines, use a different virus called an adenovirus to deliver that protein to your cells and consequently to your immune system as well. And then the Novavax vaccine is actually giving you that protein in addition to an adjuvant, which is a compound that increases your immune responsiveness. So all of the vaccines are targeting the same protein on the surface of the virus particle, and generating immune responses to that, which is how they work. Now, the reason why we need different vaccines, given that they have different efficacy profiles, is because there are going to be different situations in which a given vaccine is going to be more useful than another. So the Moderna and Pfizer vaccines, the mRNA vaccines, for example, are extremely efficacious at preventing symptomatic COVID-19, and that's fantastic. But they do have pretty stringent cold chain requirements. They have to be stored long-term in ultra cold freezers that are not widely available even in the United States, much less in other lower middle income countries where there's not necessarily as much healthcare infrastructure. So those vaccines are great, but they're also difficult to deliver and present major distribution challenges. The Johnson & Johnson vaccine, which shared some of its clinical trial data today, is an adenovirus vector vaccine that doesn't have as stringent of cold chain requirements. And this was tested as a 1-dose regimen. So that means that people won't have to go back to get their shots. It also means that it will be easier to distribute in places that don't have access to dry ice or those ultra cold freezers. And the Novavax vaccine is a protein subunit vaccine. It also doesn't have stringent cold chain requirements. It does require multiple doses, but these protein subunit vaccines have been used very, very effectively for other types of viral diseases such as hepatitis B. So all of these vaccines have their advantages and disadvantages. They present unique challenges in terms of distribution. But the good news is they're all relatively efficacious at preventing symptomatic disease. And in the case of Johnson & Johnson, it's a little less efficacious at preventing symptomatic disease overall, but it's very efficacious at preventing severe disease. All of these things are going to be incredibly beneficial for public health and may be appropriate for different settings and different communities. And I think I'll stop there and let Dr. Parikh take over. But yeah, that's basically the vaccine landscape that we're working with now in terms of all the vaccines that have been authorized for use worldwide.
I really appreciate that short course, and I know that all of our listeners do too. Dr. Parikh, I'm really interested in your perspective from someone who is involved in clinical trials on 2 different vaccine platforms. Anything you can share about your thoughts about the comparative science of these formulas or how they behaved in the trials or just what your experience was?
Right. And, thank you, Dr. Rasmussen, for that excellent overview. I couldn't have said it better myself, but all of those points. And I agree, the reason why we have these different platforms, I'm an immunologist, but also an allergist. There are some people who may not be able to immunologically tolerate a certain type of vaccine. If they may have an allergy to one of the ingredients, albeit that is still very, very rare, it's good to have other options. In our trials, both were tolerated fairly equally. And interestingly enough, a lot of the side effects were very, very similar between the Pfizer mRNA vaccine trial and the AstraZeneca, which is that adenovirus vector platform that we just heard about. So it was still very, very similar that, people would feel the fevers, chills, fatigue, myalgia for maybe 24 to 48 hours after the vaccine, but then many, were back to normal. There weren't any severe side effects or persistent side effects. Now, I know there's been a lot of concern with the trial participants and general public that, these vaccines all have different efficacies, so what if I get one that is quote unquote less efficacious, but you have to look at it from kind of a public health standpoint that, if you think about it, our influenza vaccine that we distribute year to year has only about 40 to 50% efficacy, depending on the year. So still all of these vaccines are showing better efficacy than that. And we know that the flu vaccine saves lives. It decreases hospitalizations. It makes you less ill if you do happen to contract the influenza virus. And so that's why it's very important, especially in certain areas of the world, as Dr. Rasmussen mentioned, who may not have access to these deep sub-zero freezers. The cost is also key. AstraZeneca is much easier and cheaper to produce in mass compared with some of these mRNA vaccines. And, as these new variants are emerging, it's also great to have different options. So that way we can test which vaccines may be efficacious versus different variants as they emerge. The mRNA platforms, the nice thing about them is they're relatively easy to update and tweak compared with some of the other ones. So it's great to have different technologies. We need to get to that herd immunity standpoint, where close to 75 to 80% of the population is vaccinated. And currently with only mRNA technology vaccines, we don't have enough doses. So we need these other options for various reasons, whether it be patient tolerability. As we learn more about these vaccines, there might be certain people with certain medical problems where certain vaccines are more efficacious. Again, similar to influenza, how we have different formulations. So for all of these reasons, I think it's exciting that we're seeing new technologies and we're seeing that they're working. Because back in May when we started this journey, we didn't even know if any of these vaccines would be efficacious or would work. So I think it's an exciting time for the global scientific community in general.
Thank you so much for those remarks. Dr. Restrepo, I'm particularly interested to hear your thoughts about how the achievement of different vaccines on different platforms with different storage requirements and dosage requirements, what that's going to mean for rolling out a vaccination campaign across the world, particularly in low and middle income countries and underserved areas.
Yes, so 3 points. First, WHO is committed with all our partners to fair and equitable access to vaccines. And so far, we haven't fulfilled collectively this promise. As you probably have heard our Director General, the challenge now is to ensure that all these discoveries, all these technologies reaches everybody who is at risk, everybody who may die. And we need to work for that. So I want to add to the comments on the challenges for the logistics, etc., that you should remember that this planet, this humankind, eradicated the smallpox working on the 50s and the 60s without internet on the scenes that we have today. That we vaccinated 350,000 people with Ebola vaccine in the eastern part of DRC, where civil war and etc., and maintain that vaccine between -60 and -80 degrees. That we have an immunization program that reaches almost 9 out of 10 people who should be vaccinated. So collectively as humankind, we have a lot on our hand that we can build on. The second part of it is that WHO is working with the countries to ensure that they are prepared for the deployment of vaccines. I must say, coming from the Southern Hemisphere, that the countries in the Southern Hemisphere, luckily in this occasion, have more long-term experience in conducting mass campaigns. So some of the things that are being established for the first time in some of the industrialized countries occur every year as a miracle, to vaccinate everybody under 5 years of age for polio, or we have vaccinated everybody under 15 years of age for measles elimination, or everybody under 39 years of age for rubella and measles control efforts. So I am not saying this will not be a challenge. It will be a challenge, a considerable challenge, but luckily the countries in the Southern Hemisphere that lack some of the infrastructure have some of the experience in conducting and reaching out in these mass campaigns. And we are working with clear established criteria with our partners and looking at the preparedness of these countries and helping them to prepare for that. And the third point that I want to mention is that while we talk about the beauty of vaccines, since this is a conversation for members of the press and journalists, it is very important that we do not overemphasize the role that vaccines will play in controlling this disease, because it is quite trendy and very sexy to speak about vaccines and to throw around numbers of vaccine efficacy. But for the common person who is listening, this person may get the wrong message that he or she cannot do anything until the vaccine reaches their arms, but they can do a lot today. We can talk to them about social distancing, about wearing masks, about protecting themselves and their families. And we should not deviate that message. It's very important, particularly when we haven't fulfilled our obligation globally of having fair and equitable access to vaccines.
Dr. Restrepo, I so much appreciate the reminder that the global South has so much to teach the industrialized West in terms of what it really takes to mobilize to deliver vaccine, because for so many decades, it has been the centerpiece of the polio campaign and the measles campaign. There's wisdom there in the global South that I think the industrialized West could benefit from in this largest vaccination campaign, possibly in world history. I want to turn to the question of which we're getting a number of questions from the watching audience about how the emerging variants of the coronavirus may challenge the vaccination campaign. I think Dr. Rasmussen, I'll go back to you to start with to see if there's anything you can say, again, maybe another little short course about what people need to know about these emerging variants.
Sure, absolutely. So this is something I think that's been pretty confusing, especially this week, as a lot of new news has come out about these variants. What people should understand is that variants have been emerging through the entire course of the pandemic. Every time a virus like a coronavirus, which is an RNA virus, replicates, there is the opportunity for it to acquire mutations. And that's what a variant is. It's a virus that has acquired one or more genetic mutations. Most of the variants, and mutation is a random process, so most of the variants have mutations, but they don't actually have any sort of functional significance. One SARS coronavirus 2 variant will be similar in terms of the disease that it causes, in terms of its transmissibility as another. The reason why we're concerned about these three variants, the B117 variant, which was first discovered in the UK, the B1351 variant, which was first discovered in South Africa, and the P1 variant, which was first discovered in Brazil, is that they do appear to be more transmissible than the other variants that are currently circulating. Even more worrisome, the B1351 and P1 variants have a number of mutations in the receptor binding domain of the spike protein, which is the part of the spike protein that interacts with the host receptor ACE2 and allows it to enter a cell. That is important because not only does it potentially make those spike proteins better at infecting cells, but it also is an important site for antibodies generated by vaccines or natural infection to bind the spike protein and neutralize it or render it non-infectious. So there is concern that the vaccines that we have now, which were developed against previously circulating variants, won't work as well in terms of generating neutralizing antibody responses against these variants. And that does seem to be the case to a certain degree, based not only on in vitro experiments or experiments in the lab that were done by Moderna and Pfizer with serum or the liquid component of blood from vaccinated individuals using the B1351 variant, but also data now from the clinical trials conducted by Novavax and Johnson & Johnson that may suggest some reduced efficacy in South Africa, where the B1351 variant is widely circulating. So that is a matter of concern, but I think that people should also realize that the manufacturers have heeded this warning. And to me, that's very encouraging news. So they've all announced plans, or at least Pfizer, Moderna, and Novavax have all announced plans to begin developing boosters that would be reformulated to target these variants. And so the idea there would be that you can get your full vaccine regimen, whatever vaccine that is, and then you can go back and get a booster that will elicit antibodies against these particular variants, and that should theoretically boost efficacy. Now, we are still in early days, and while it's great that plans have been announced to evaluate that, there is a longer regulatory process in which those boosters will have to be tested. We'll have to make sure that they are actually providing a benefit. And then, of course, they'll have to be manufactured. But the good news is, even though there does seem to be some reduced efficacy with the B1351 variant, it's not completely abrogated. So the vaccines still work. They just don't necessarily work as well, but they do provide still a significant protective benefit to people who are getting them. So people should still, when they can, get the vaccine. And I can't agree with Dr. Henao-Restrepo's perspective enough that right now we are not able to get the vaccines out to everybody. To prevent these variants from becoming more capable of evading immunity initiated by the vaccine, we do need to be encouraging everybody to really double down on the non-pharmaceutical interventions that can also drastically reduce transmission, because a virus can't develop new, better variants if it can't replicate. And the only way to keep it from replicating is to cut transmission. So we really should be encouraging people not only to get vaccinated once the vaccines are accessible to them, which is obviously a high priority, but we need to be encouraging people to take steps to keep themselves safe and reduce their own exposure risk now.
Thank you for that. Dr. Parikh, because you've been involved in actually getting vaccines into arms in the clinical trials, I'm curious what this expectation that two vaccination doses won't be enough, that will have to be boosted at least once, maybe periodically, what that looks like from your perspective. Does it feel a reasonable thing to do, not just scientifically, but socially, I guess? And how do you think the community that you're working in would react?
Right. So, I think it is reasonable, especially if we are seeing that some of our current candidates may not be as efficacious. And again, I couldn't agree more with what the other panelists had said. Masks, social distancing, all of those things have been labeled as crude vaccines. And so we need those to bridge us over. But I think what it will look like is with even our current clinical trials that are going now, it will be amended so that there will be another arm in which we can start supplementing that third dose to people who've already been vaccinated. Or there may be a whole new study design created with that 3-dose regimen or 2-dose regimen in the instance for Johnson & Johnson. But I think that the current community is looking for that. Interestingly enough, with as much vaccine hesitancy as we have, we've also been seeing people, desperate to get it, especially with some of the areas in the US where the rollout has left much to be desired. We're still getting a lot of requests to enroll in these trials for just a shot, no pun intended, at getting the real vaccine dosage. All of our participants who are in the trials have now been offered the real vaccine had they been given the placebo earlier, and many have been calling, anxiously to get it. So I think, from a social standpoint, people are accepting and willing, and I think from a immunologic scientific standpoint, we do need to test these things because as these variants emerge, we need to make sure we're well equipped to take care of them. Especially in the US, unfortunately, many of our hospital systems are already at breaking points, similar to what New York saw early on in the pandemic. Now we're seeing the same thing in Los Angeles and Arizona and in Texas. So again, those death rates are going to keep going right back up unless we have ways and tools to get around it. And that includes the vaccine, that includes all the mitigation measures as well. I know we've been now recommending even double masking. Dr. Anthony Fauci has been recommending that as well because of the easy spreadability of the new variants and the contagious nature of them.
Thank you for those comments. Dr. Restrepo, I would be interested to hear your thoughts on what your other two panelists have emphasized just now, which is the necessity of keeping up with all the other things that prevent infection as we wait for vaccines to roll out: social distancing, masking, being conservative out in public. It seems to me we are asking a lot of the developing countries to live with those conditions longer while they wait for vaccine. Do you have any thoughts about that?
Yes, I want to make 3 points again. The first point is an issue about the science and the evolution of the pandemic. We are learning every day. We are discovering new things every day. So I think for the members of the press, for the journalists, for the people who have a forum of communication, it is very important to acknowledge that and not to use it as a brouhaha for the headlines, but with a responsible communication approach to say, not because we learned something today that we didn't know last week. For example, the strains, we know that virus mutates. We didn't discover this in December. We knew that this virus will be likely to mutate. We didn't discover that in December. In fact, the strain that is circulating widely before the variants were identified was a mutation itself. So we knew that. What is important, and you have to communicate to people, is that we identify it. We have a mechanism to evaluate the public health relevance of these variants that has emerged in place A or place B, because more will emerge, and we have a mechanism to deal with it. How? We are getting better surveillance, better identification, we are working in a coordinated fashion to evaluate the implications for other control measures, including the vaccine. So I want to emphasize on that because it's very interesting to go through the rabbit hole of the number of the headline and lose the perspective. We need to be honest with people, but we need to explain to the people that we have it, that there is a system working to address that new challenge every time, rather than to put it like, oh, now this is the end of the story. That's the first thing. The second is the question about the control measures. We recognize, and you have heard our Director General many times talk about the reality of people who earn their food they eat every day. And if they don't work, if they don't go out, probably they will not eat. That's a reality in many countries. In the country where I come from, for example, it's a harsh reality. So yes, we are asking a lot from people, but this is also why we need to communicate. And we were discussing with some colleagues, there are social networks. For example, in a part of my country, there is no social security like in the United States. People who go out of job have no social security. So what they do is they put a red flag if they lack food, and a green one if they want to contribute food. And volunteers go around moving the food between places. There are tremendous examples of positive community support for the implementation of the control measures by the state and by the communities itself that we should talk about, rather than the latest brouhaha on the new number if it's 25 or 27. And I don't want you to feel that we don't want to discuss the challenges. They should be discussed, but also the other means. In some of the Asian countries, they are able to control the disease better because at the community level, when there is a case, the community provides support to the family of this case so the person can isolate and they don't go starving because they help to identify the contacts and facilitate that the contacts are in isolation. So it is not a political factor, but everybody helping to ensure the virus stops there. And we have a big opportunity through the press and the social media to also highlight these stories as positive stories, as ways to have interruption of the transmission by means. And yes, this is all true, but we need to continue to work and be vocal about when are we going to have and fulfill our moral obligation, as Dr. Tedros says, of ensuring every person at risk in this planet have access to the vaccines. So I, as a person from the South, find very difficult when scientists try to discuss 200 hours what happens in the United States and only that. It is very important because every person in the planet has value, that we should use the same number of hours or more to discuss how to protect people in other parts of the world. Everybody has a life that has an equal value, and we should reflect that in our actions, in the press, in the social media, and in our public health recommendations.
Thank you for those comments. What you just said chimes with things that are being said by a number of people in our live chat and also in comments that are being sent in, all of which address the question of whether vaccine supply can be scaled up to a truly global need. And the questions have to do with the questions have to do with both whether vaccine production can be nationalized, what it will take to increase production of vaccine, and also what the significance is of vaccine formulas that are being produced outside North America and Western Europe, for instance, the Russian vaccine and the Chinese vaccine. These are very broad questions. I don't really know to whom I should address this. Dr. Restrepo, would you like to begin?
Yes, I want to say that we have 3 ways to ensure that every person has access to vaccines, grosso modo. One is to ensure that we have more doses of the vaccines we already know that are effective. And that includes all the vaccines, regardless of nationality, that fulfill certain international standards and certain scientific criteria. So we should continue to work. There is already lots of efforts from partners through COVAX to Operation Warp Speed through efforts of the European Union and several other governments to expand the capacity. That's number one. Number two is we need to continue to evaluate more vaccines, more candidate vaccines, to test more vaccines for some of the reasons that were mentioned. Maybe they have attributes that are more important for public health. Maybe they can be efficacious with one dose, or have simple cold chain, or don't require injections for administration, or be more suitable for certain people at a certain age. So we need to test more vaccines and have more vaccine available. And the third part is that we need to use the epidemiological information at the local level, at every place, to identify the people at risk, so that we can stop using the vaccine and the other control measures, stop every chain of transmission. So we have three broad strategies that are very critical and equally important. And I just want to plead, the person who thinks that everything will end when the vaccine reaches him or her is misleading. Everything will end when we put in a concert of measures, control measures, that will stop the transmission. So if I can contribute to stop the transmission in my neighborhood, in the tower building where I live, in the village where I live, I am already contributing as much as the vaccine developer. And this is what people should be convinced of, that it's a very difficult circumstance. And as I say, I cannot speak as a person from the South. I speak with my family and I hear of the hardships of millions of people in my country and elsewhere. And this is what motivates us and many others to continue to work. But we need to transmit this information. If we focus only on talking about this vaccine has 95 and this 85, and I have a long debate about that, obnoxious, because it has to be debated, but there has to be a point where you move into what it means for the control of the disease. How can we ensure that when I have symptoms, I can go and test myself so that I can self-isolate if I am sick? How can I give the encouragement to all the people who were my contacts to self-isolate so the virus doesn't spread in my family or my community? And what kind of social network support I can get from the state or from my community to be able to implement these measures? It's really very important, very hard, but it's critical. If we don't do that, it's going to be very difficult to get out. We need to do it, and we can do it. I am, as an epidemiologist and as a person that has worked 40 years in public health, convinced we can beat the virus, but we need to work together. That's for sure.
I want to turn to a topic that is so important to the people who are watching, and it is certainly crucial for all of us who have been working on attempting to educate the public. And that is the question of mis and disinformation around the vaccine from the perspective of scientists, virologists, epidemiologists, clinicians. And so I want to ask each of you what you have been running into in terms of mis and disinformation and misunderstanding around the vaccines and how they work, and what you have been doing to combat that. And Dr. Rasmussen, I know you made a big point of this in the past year, so I'm going to start with you.
Well, I feel like I could probably talk about this topic for an hour because there really has been so much misinformation. So maybe I should just stick to some of the more recent misinformation. And this is not even, I think this is how misinformation begins, right? It's the point that Dr. Henao-Restrepo was just making about focusing on the efficacy. You know, yesterday we saw the Novavax results get released, and already I'm seeing, oh, this vaccine doesn't work. Because it was less efficacious than Moderna and Pfizer. And that completely misses the point about what Dr. Henao-Restrepo was just talking about, that we, really need to work together. This is about global control of this pandemic and not about whether one vaccine works a little bit better in a certain population than another. I think that around vaccines, obviously, there's a ton of misinformation as well as disinformation, and this has been going on long before this pandemic. With regard to the vaccines, we've heard from the beginning that all kinds of things that are really anti-vax talking points, and they're really intended to drive a wedge into the conversation and make people not want to get the vaccines, or at least increase their skepticism and hesitancy about getting them. For example, there's been rumors going around that the mRNA vaccines, because they are genetic material, will somehow modify your DNA. It's impossible for an mRNA vaccine to do that. But that has gained traction. And because often the people who are deliberately spreading misinformation, in other words, disinformation, are doing that in circles where they are more likely to be believed, where they have credibility, they are able to get these ideas circulating in people's minds, and they really spread themselves almost like a virus, so that you have people who are not part of these really diehard opposed to vaccination communities repeating these talking points because they heard them through the grapevine from a source that eventually they thought was credible. And when people are talking about it with their communities, with their friends and neighbors, they're not necessarily hearing about it from scientists. And scientists, I'll be the first scientist to say, are not always great at communicating about this. We think that we can come in and say, oh, that's not true, here's the data. And oftentimes people don't respond to that. That is not addressing people's actual concerns. That is not helping to educate them on why that is wrong. And that's also not helping them understand that this is disinformation in a larger context. And I think that this is something that we all need to be pushing back on pretty regularly in terms of not just correcting things that are factually untrue, but also listening to people and hearing what their concerns are, and understanding better why this misinformation is taking root and spreading within these communities. We shouldn't be shaming people for spreading misinformation because, oh, that's not true, that's fake news, whatever. We should be really listening to people's concerns and taking them seriously, whether they're factually true or not. And then we should respond to those equally seriously, taking those concerns to heart. I think that we could do well by listening to what those concerns actually are. And that's going to make big strides in the long run in terms of combating this misinformation and disinformation that's flying around.
Dr. Parikh, you work at a medical center that serves a really wide swath of one of the both richest and most unequal cities in North America, maybe in the world. So I am really curious what you have been hearing, either from trial participants or from the allergy and immunology patients whom you see all the time, about what their concerns are about the vaccine and where the doors are through which you can transmit more accurate information.
Right. And I couldn't agree more. Everyone, even in national polls, say that they trust their own personal physician over, public figures, right, over the government. And I personally have convinced more people to get the vaccine with one-on-one conversations over any media appearance that I've done, anything that I've posted on social media, because it's exactly what Dr. Rasmussen was saying, is you need to hear what the person's concern is, right, before just spouting information. So my patients have come to me with all sorts of concerns, and now others have found me on social media as well. And outside of the, modifying DNA, which I have heard a lot, I've also heard that these vaccines can make you infertile, and which is also absolutely not true, especially from the allergic community. There's been a lot of anxiety about these allergic reactions. And this is where I think, journalists can really help us out in dispelling this misinformation, because I've seen it time and time again. There's so many headlines that are very scary, right? But then when you actually read the article, many times the content has nothing to do with the headline. But to the layperson, they may see the headline and say, oh my God, all of these allergic reactions are occurring. I can't take the vaccine. Something terrible will happen to me. But then if you actually look into it, it's actually very, very rare. And many of what had been labeled as allergic reactions in these rollouts, when we looked deeper, only 10% actually met the criteria for an anaphylactic or an allergic reaction. So that obviously has been a big concern amongst the patients I treat, because every single person has some sort of allergy that I take care of. And when I sit down with them and I say, actually in our trials, we included people just like you and they did fine. There's millions of people with very, very severe allergies who have received this vaccine and had no problem. That's reassuring. But then when they see the headline, I don't blame them, a sense of panic occurs. So I think this is really where we do need journalist help. The one-on-one conversations are so helpful, but there's only so many hours in the day. And, between the three of us on this panel, we can't speak one-on-one to everybody to reassure every single person. So what I ask, at least of the media and the journalistic community, is have the headlines actually reflect what your expert is saying, because it's even happened to me that what I've actually said was completely taken out of context when it ended up in print. And that is concerning because you're missing the full picture. And given health disparities, as you mentioned, that's a huge problem all over the world, but especially in New York City, because we've had certain zip codes and certain areas of our city that have had almost 3 times the death rate from COVID-19, the complication rate from COVID-19, and much of it is all due to these disparities. So in this vaccine rollout, which has left much to be desired, I think, nationally, but even within our local governments, those disparities have to be addressed. There needs to be 24/7 access, the same way it's needed for testing, for isolation procedures, but for vaccines too, to have that rollout going around 24/7. And I couldn't agree more that, we can't only focus on the US. We can't only focus on the big cities there, because, the United Nations Foundation has a great line where they say, an outbreak anywhere is an outbreak everywhere. If we don't look out for our neighbors globally, there's no way we'll get this under control. We can't have that tunnel vision and only look to the US or only look to New York City to control such a contagious and virulent outbreak. But yeah, the disinformation and misinformation is everywhere. And majority of it is not true. And I think outside of the one-on-one conversations, which I think are the most effective in my personal experience, we really need the help of the journalists and the media community to help, put proper attention on what the actual facts are versus the sensationalism. There were so many headlines about, a handful of allergic reactions, but not about the millions of who with allergies that received the vaccine with no issue, or any of the, coverage on women of childbearing age that were in the clinical trials. Actually, some of them are pregnant now. So it clearly does not cause infertility. I'm of childbearing age. I plan to hopefully start a family, yet I've had both of my doses. So, these are the things that need to be amplified, and we ask for your help in that.
I really appreciate that you raised the question of what journalists can do, because that was going to be my last question, and we have just about 5 minutes left. So I'm going to move into that. And Dr. Genaro Restrepo, I'll start with you, because you as a member of as a native of the Global South, so many of our listeners today, both in this webinar and on YouTube, are residents of the Global South themselves, and many of them are journalists. So what would your lessons or your requests particularly be for the core of journalists in the Global South as they push information out to their communities over the next year?
Yeah, I have 3 messages for them. We have a global immunization program that reaches 9 out of 10 people who are at risk of vaccine-preventable diseases. This global immunization program prevents millions of cases and deaths every year. So we know how to do it. And despite all the discussions about hesitancy and scares and resistance to vaccination, the truth is that we reach 90% of the people every year for the last decade. So that we need to focus on what we can achieve. Second, I want to echo what Angela Rasmussen was saying. When a committee recommends a vaccine, what actually they do is they do an evaluation of risk and benefits. They look at the risk of the disease, they look at the safety profile of the vaccine, and the benefits, the protection that could be induced by the vaccination. So, and this is how vaccines get recommended after the thorough evaluation and review of the risk and the benefits. When I make a decision personally to receive or not a vaccine, I should do the same. I should evaluate what are the benefits and what are the risks for the vaccines, and assess as an individual if the benefits outweighs the risk for me as a person, for my family, for my community. And to achieve that, to ensure that each person can actually do that, then we should all work together to transmit information that is reliable, that is based on data, and that can be challenged and verified. And I think this is the main thing I will ask the journalists is when we come out with recommendations from WHO, everybody says, what is the data that WHO used to issue that recommendation? Show us the data. Which is the expert panel that issued that recommendation? Are they independent? When we issue warnings of misinformation to people, when journalists duplicate and transmit this, they don't ask these questions to the person who is issuing this. They don't ask them, what is the data that you have, that your claim is a valid claim? It's just your opinion, or what is the information? Can it be verified? Can it be used? So I think it is very important that as journalists, as communicators, we always check our sources. You always do when you are talking about politics. Why don't you do it when you talk about science? Why don't you do it when you are raising issues that make influence the decision of a person somewhere and known to you, of not receiving a vaccine and maybe dying? You see, I think this is a question of responsibility. Therefore, my final comment for everybody, and I do a plea as a woman, as an epidemiologist, as a member of the WHO, is please be responsible with the information you transmit. Please verify your sources. Please be ensured that if we challenge you, you cannot just say that somebody told you in a chat group, but actually there is data, reliable evidence, and no conspiracy theories behind each of your statements.
Thank you so mumuch for that. We are very short of time. I'm going to ask the other two panelists if they can to give us a bit of wisdom for all the journalists listening in just 1 minute each. Dr. Parikh, I'll go to you first because you, I think, have unique insight into sort of neighborhood networks of information and disinformation. What are your thoughts?
Yeah, so, my main thought is echoing what most have already said, but again, it's usually those attention-grabbing headlines, those clickbait things that really get people's attention, and people have short attention spans, so they may not listen to the full report or do their own research. So make sure that those things are also formulated with your expert to make sure that they're conveying the right message, because they can have unintended consequences, especially in some communities that may have varying levels of education. They may see a headline and assume one thing without fully understanding the context in it. So that would probably be the biggest point that I would make, that the whole piece, if you can work with the experts, I think you would get the message across much more effectively and accurately.
Thank you. And Dr. Rasmussen, I'll turn to you last, because I know you've been talking to journalists a lot this past year. I know you've spoken to me several times, and I'm very grateful for that. You've seen how journalism works. What are your pearls for what journalists should do going forward as they cover vaccination?
Well, I would just say that I completely echo the statements about fact checking your sources, and also listening to those sources. Like if somebody asks me what is going on with this epidemiological model, I'm going to say, I have no idea, because I'm not an epidemiologist, I'm a virologist. And responsible experts will actually do that. I have seen a lot of people quoted who have no expertise whatsoever in infectious diseases and epidemiology, talking about all kinds of things like treatments, vaccines, criticizing WHO policies. All of those things are really, really harmful. So if a journalist is going to cover a story like that, something that has a major public health implications and that people are very, very interested in, I just implore them to fact check their sources and make sure that they're talking to people with the appropriate expertise to comment. It's fine to have differing opinions. It's fine to interview experts who disagree with each other, but just make sure they're qualified to actually do so.
I just want to thank all three of these panelists for their time and their They're sharing such amazing wisdom with all of us. I know that all the journalists and everyone else watching this from literally all around the world will benefit so much from this. Thank you all so much. We will be back in just a couple of minutes to spend an hour on the immense challenges of the logistics of delivering the COVID vaccines. Thank you.
Hello again, and thank you for being here with us today. I'm Mallory Tenori from the Knight Center for Journalism in the Americas at the University of Texas at Austin. Our first two panels have been so informative, and I hope that you found them helpful. If you're just joining us, welcome. I want to remind everyone that this webinar is being interpreted into English or Spanish, Portuguese, French, and Arabic. So if you click on the interpretation link in the bottom right-hand corner of your Zoom screen, you can select the language you want. And if you have any technical difficulties with Zoom, you can always tune in via YouTube, where we are streaming this webinar. And those YouTube links will be in the chat feature of Zoom. So we're also trying to address audience questions. We have a lot coming in from around the world, which is great. So please go ahead and continue to share those with us, and we'll be doing our best to address those. So we're now going to begin our third and final panel, where we will be examining the logistical challenges of vaccine distribution internationally, including socioeconomic challenges. And we've got a stellar lineup of experts with us today. So I would now like to turn the conversation over to our moderator, Marion McKenna, who will introduce these panelists.
Good morning, everyone. Thanks to our audience literally from around the world. It's so exciting to see so many comments from so many countries about so many aspects of this incredible crisis, that extended crisis that we all find ourselves in. I'm Maren McKenna. I am a journalist in the United States, an instructor with the Knight Center's MOOCs, and senior fellow of the Center for the Study of Human Health at Emory University. And we're going to tackle now maybe the thorniest part of this extended crisis, which is the challenge of vaccine distribution, its logistics around the world. And I have an astonishing panel who are now going to connect. Dr. Scott Ratzon of the City University of New York School of Public Health, Claire Hannon of the Association of Immunization Managers here in the United States, Dr. Josh Michaud of the Kaiser Family Foundation, which has been tracking data regarding vaccine distribution and attitudes toward vaccination, and Catherine O'Brien of Johns Hopkins University and the World Health Organization. Thank you all so much for joining us. We really, really appreciate it. And I know our extended global audience does as well. So I'm going to begin by asking each of you to introduce yourselves, tell us what you do in normal times, if there are such things, what you've been doing with regard to the pandemic, and especially if you are working on anything now regarding vaccine distribution or logistics. And Scott, I'll start with you.
Well, thanks, Maren. Thank you for the opportunity to be here today. So I'm Scott Ratzon. I'm based at the City University of New York School of Public Health, and I've been editing the Journal of Health Communication for 25 years, dealing with some of these difficult issues that we have to communicate health, which I believe is our common currency. Currently, what we've been working on is we formed a group called CONVINCE, which is a global coalition, and CONVINCE stands for COVID New Vaccine Information, Communication, and Engagement. And this group that we formed with Heidi Larson, Heidi is based at the London School of Hygiene and Tropical Medicine. It's been one of the world's experts in vaccine confidence. We are trying to put together a way that the world, and those of us in networks, can begin to address the challenges that we have to build vaccine confidence, and particularly around the COVID vaccine. We've seen this happen, unfortunately, with demise in just routine childhood vaccination that we had with measles before COVID even hit. And now we see a big challenge where in our global surveys, 10 to 20% of the population is straight out refusing or denying vaccines as efficacious and important. And roughly 40% of people around the world are hesitant, wanting to wait and see about getting a vaccine. So we're focusing on this side of it. How do we communicate better? We've developed a term, which is an aspiration of vaccine literacy, what people need to know about how vaccines work, how the system can be simplified for us to choose vaccines, and then finally, how we have the wherewithal to continue to build long-term acceptance and uptake. As vaccines have been around for 3 centuries, we now have to inform the people well enough with the right evidence base and science to get the vaccination. So, thank you, Maren. Today, I'm hoping to have an opportunity to talk, 1, about CONVINCE, 2, I'm happy to talk about the journal, and then 3, there's a whole business partners to CONVINCE that has a global workplace challenge that I think we all can aspire of working throughout all sectors of society. Thank you.
Thanks so much, Scott. Josh, could you please introduce yourself and tell us about your work?
Sure. Hi, I'm Josh Michaud, and I'm Associate Director for Global Health Policy at the Kaiser Family Foundation. It's a great pleasure for me to join all of you today. To give you a little bit of information about what KFF is, we're a nonprofit, a nonpartisan organization that is positioned to provide information, analysis, data around health policy issues of importance, both in the United States, and I work with a group that focuses on international health as well. So my background personally is as an infectious disease epidemiologist and a public health practitioner. And at Kaiser, I've been in the role providing analyses about the US federal and state level government roles in health policy. And right now, the top health policy of the issue of the day is COVID, of course. So the work we do across KFF is varied. We have tracked the prioritization schedules that states have and which groups they're emphasizing in terms of their vaccine rollout. We do work on racial equity and the vaccine rollout. We have also set up polling of the American public and their attitudes towards vaccines. And we have a project called the COVID Vaccine Monitor, where we provide regular updates on how the American attitudes towards vaccination. And then finally, I'd just like to mention that KFF also oversees a news organization called Kaiser Health News. It's editorially independent from the organization, but they provide media stories of all kinds on health policy issues, including on vaccines. So I should just say my other hat is as a professor, and I teach public health and global health at Johns Hopkins University as well. So it's a pleasure to be here and happy to talk more about vaccines for the rest of the session here.
Thank you. Claire Hannon, could you please describe who you are and what you do?
Hi, good morning, and thank you for having me. I'm Claire Hannon, Executive Director of the Association of Immunization Managers. And we are a nonprofit membership association, and our members are in the states, territories, and several large cities, public health agencies managing the immunization program. So in ordinary times, we would be getting together and talking about how to ensure routine childhood immunization. We right now be talking about pre-booking for flu vaccine, for the Vaccines for Children program. We get our members together and share best practices on enforcing school requirements, doing all the things to ensure that the population is protected from routine vaccine preventable disease. Of course, during the COVID, we have been working to plan for the rollout of the COVID vaccine, and now, of course, implementing it. And our nonprofit really we work to get our states to be able to work together. We provide a forum for them to talk through challenges, to share lessons learned, to share best practices. We keep them informed of what's going on, especially at this time when they can't stay on top of everything that's happening. So those are the kinds of things we do. And I actually did not have really any kind of interaction with the media before this year. And I have to say that I'm just so appreciative of the journalists that have worked with us and really listened and taken the time to get stories correct. And, I appreciate that. And I'm so glad to be here today.
Thank you so much. And finally, Dr. Kate O'Brien. If we could hear a little bit about what it is you do with regard to the pandemic and vaccination, and then I'll start our rounds of questions.
Yeah, I'm pleased to be with you all. Good morning, afternoon, evening, depending on where you are. My name is Kate O'Brien. I'm the director of the Department of Immunizations, Vaccines, and Biologicals at the World Health Organization. So I'm speaking from Geneva tonight. And in the pandemic, as you said, what has been our role? My role or our role in the pandemic, obviously very, very, very broad. Specifically with respect to what WHO's role is with respect to the vaccines. We are responsible for elements across the setting of policies on how vaccines should be used. We're responsible for the fair and equitable allocation of vaccines that come through the COVAX facility, and I'll talk a bit more about that. That's the partnership between WHO, Gavi, the Vaccine Alliance, and CEPI, the Coalition for Epidemic Preparedness. And this is the global mechanism for aggregating procurement of vaccines and fair and equitably distributing them around the world to countries. There are 191 countries or economies that are part of the COVAX facility that represents over 90% of the world's population. We also have responsibility at WHO for monitoring safety of vaccines and setting norms and guidance around how to monitor safety and supporting all countries in the safety programs that they have for monitoring vaccines. We also have the program in WHO for either pre-qualifying vaccines or what we call emergency use listing of vaccines. This is the equivalent of a regulatory process. We are not regulators, but we support the regulatory process in all countries by reviewing, along with a national regulator, the evidence on efficacy, safety, and quality of manufacturing. And when WHO puts its brand on, or its mark on a product as having achieved emergency use listing, it indicates that we've reviewed in detail all of the data on those three elements and can verify the quality and that it meets the highest international standards. We're also responsible for country readiness and rollout of vaccines, especially supporting low-income and low-middle-income countries, but frankly, all countries around the world. So we, along with UNICEF, have been coordinating the global partnership, which consists of hundreds of people who are working on the support to countries for readiness and rollout of the vaccines. And then finally on research prioritization and research support, as well as data monitoring of the doses of vaccine and the vaccine coverage, as well as the policies and the products that are being regulated and authorized for use in countries. So we cover the gamut from the very, very upstream side of support all the way to actual operational support to countries for training and the specific rollout of vaccines. Thank you.
Thanks all of you for introducing yourselves to our incredibly wide audience of listeners who are coming from literally all around the world, both in this Zoom platform and watching on YouTube in a number of languages. So we really have, I think, two main things to talk about during this panel. The first is the challenges of the distribution of the vaccine, and the second is the challenge of how the vaccine is perceived and how we rectify understandings of the vaccine. So I want to talk about distribution first. And I'm going to turn first to Claire Hannon, because while the rest of the world might think of the United States as a great political power and a place that is very affluent, in fact, our vaccine rollout has been quite challenged. And one reason for that is because of the unique political structure of the United States, in which it's the 50 state governments plus territories and districts that are each managing their own vaccination distribution. So Claire, could you talk for a few minutes about what you were hearing from your organization's members about what vaccination rollout looks like across the United States and what hiccups to distribution and receipt they have perceived?
Sure. So true. And I mean, I think it's such an unprecedented challenge here in the United States. We have a government financed vaccine, which doesn't usually occur. We have a state-based, as you mentioned, government system, public health system is state-based. And then, we're trying to use private providers, our private healthcare system to distribute the vaccine. So marrying those three things has proven to be very challenging, although I do think we've done an incredible job that states have enrolled tens of thousands of private providers, gotten them to agree to give the vaccine free of charge, to store it properly. We've trained them. And so that groundwork is laid, and also connected 64 or at least 50 different state-based immunization information systems. So the data flow. So getting that groundwork done was very challenging. Now that the vaccine is being implemented, states receive a weekly allocation, and they spread that allocation across these enrolled providers. And the concept is doing that in phases. In phase one, really trying to get phase 1A, getting healthcare workers and long-term care facilities vaccinated, and moving out to phase 1B. In most states have done this, is over 65 or over 75, and also some essential workers. So that's what's going on now. I think we've learned that spreading the vaccine across a host of private providers, across mostly hospitals for phase 1A, while this is good for getting healthcare workers vaccinated where they work, it was not necessarily the most efficient thing. It's very difficult to prioritize that way. And many of these hospitals took the inventory, they viewed it as their inventory. They were staggering their employees. We didn't have efficiency. So as we've moved into phase 1B, a lot of adjustments have been made, and many states are setting up more large scale, centralized, high throughput clinics where they can really manage the inventory, they can vaccinate, they can schedule around the clock. We still have this very real challenge of not having supply to meet this phase 1B demand, such a large group. And so many states, are grappling with that. So that's where we are. I mean, I think that allocations, as they get more steady, communication hopefully will improve, that will trickle down. So people will understand better, when and how they will get the vaccine. But yeah, we have no shortage of challenges. I think we've done some things very well. Hopefully we'll get better as we move along.
Thanks so much for that description. The United States as a sort of object example of all the different ways that things can go is fascinating to me. I did not say this at the start of the webinar, but I happen to live in the city of Atlanta, about 2 miles from the Centers for Disease Control and Prevention. And their vaccine is being given to people of a certain age. I think it's at 265 in my state, but you could drive less than an hour away and not be able to get the vaccine unless you were 75 and older. And those kind of differences in distribution prioritization are happening all across the United States. It seems to me sort of a small version of what the rest of the world, the sort of decisions that are going to have to be made. So Dr. O'Brien, let me turn to you. What do the distribution challenges look like from your perspective for the rest of the world, particularly for the Global South, low and middle income countries? How's prioritization going to work? How's supply going to work? What are the things you're most concerned about?
I think this falls into a couple of categories. First of all, on the supply side of things, the COVAX facility was designed to provide at least enough vaccine to cover 20% of the population in every country. And that was designed at a time when we expected, we had certain expectations about whether or not the number of products that were in clinical trials were going to reach efficacy and safety. And so we've seen a lot more of the vaccines that have been in clinical trials actually be successful. And of course, yesterday, another announcement, this time from Novavax about efficacy, and today an announcement from the J&J product, which is a single dose product around efficacy. So this is great news for the world. Every time there's another product that demonstrates efficacy and safety and is able to go through and make it through the regulatory process, that means that there's more supply sort of suddenly available because manufacturers have been manufacturing at risk with the hope and intent that their product will be successful. Nevertheless, what we are seeing is, in spite of what countries said they wanted to do, which was to have a global, fair, and equitable distribution of vaccine, we're seeing a large number of countries that are doing bilateral deals. And as a result of those bilateral deals, we see very inequitable distribution of vaccine across countries around the world. The COVAX facility is just about to start to distribute the vaccines that are in the facility. Those will go to the countries, the 190 countries, depending on, some countries chose certain vaccines or not, but they will start to roll out. So one of the biggest concerns is that we do have a large number of high-income countries that committed to a large number of doses of vaccine. In fact, more doses of vaccine than there are people in their country. So we're really encouraging countries that have are in that situation to now share their doses in real time with the COVAX facility so that those can be redistributed in a fair way to countries that are only procuring their vaccines through the COVAX facility. So that's one issue that we're seeing is, is the world really walking the walk and not just talking the talk on equitable, fair allocation? And the reason that's so important is that we are not getting out of this pandemic one country at a time. And we've seen that's not just a sort of moral question or ethics question. It's really about the epidemiology. It's about the science, and it's also about the economics And we know that that's true. The variants are moving around the world as we have variants that are potentially going to be less effective. The vaccines may be less effective against those variants. All of these things, we are in an interconnected world, and we're not going to beat this thing if we are going at it one country at a time. From an actual so that's from a distribution perspective. From an in-country deployment perspective, I think some of the big issues that we're seeing, having, again, we're working very carefully and closely with a large number of countries. The areas that countries are struggling with are, first of all, on the cold chain and the supply channels of vaccine. If we're trying to take billions of doses of vaccine on top of the immunization program that we already have, regardless of whether you need special freezers for ultra cold chain, for example, for the Pfizer vaccine, or if you just need a regular freezer, it still means that that cold chain needs to expand to some degree at least. So that's one area that countries are struggling with. And a second area that they're struggling with is identifying who will be the priority populations, and not just in theory who they'll be, but actually figuring out where those people are. And so that really special planning that has to take place. And I think we've heard even in the US, this has been a challenge of, what is the cutoff of age? How do you find those people? How do they know that they're eligible? How do they actually make an appointment, or where is the clinic taking place? So these really micro planning logistics of having enough places and having enough healthcare workers that can actually give the vaccines in the scale and speed that we're really intending to. So those are some of the challenges, and I'm sure there are plenty others, but those are some of the ones I would highlight.
Thank you so much for those details. Before we get further into the questions of the challenges of logistics, I want to be sure that we hear about how the mass audience, how the people who are going to take these vaccines are receiving these messages of prioritization and vaccine nationalism and potential self-dealing. So I'm going to ask both Scott and Josh to talk about the data that they have been seeing. Scott, I think I'll start with you. What do you think some of the challenges are in this very this incredibly complex environment of communicating around communicating trust in vaccines and trust in this process of rolling the vaccines out?
Sure. Well, thank you, Maren. I mean, I think it's been a big challenge on how we do this, if I could use the word diplomatically, and a term actually health diplomacy, that we have to think about how we're communicating issues. They need to have trust, they need to have transparency, and they need to be based in truth. And that's where we would hope to have messages, and hope to have not only messages, but the whole communication process. We did one study over the summer, so it's been some time, that was published in Nature Medicine, just asking people if a COVID vaccine was proven safe and effective, you'd be willing to take it. And from 88% in China to only about around half of the people in Russia. But the challenge has been many people in the middle. And how we actually get to those people, I think, is going to be the bigger challenge. But not to go into data here necessarily today as saying that is the barrier. I think some of the barriers right now is the wherewithal of different entities that are part of the so-called health polity. All of us, from getting the vaccine from the vial to the patient. That, I think, is the big challenge, and the wherewithal that Kate just mentioned so well, that we need to do this in an equitable and fair way. So whilst we know what the issue is in terms of getting a vaccine to people and getting them to take the vaccine, the challenge I see, and particularly, I thank you again for this opportunity with journalists. The journalists and the media are probably the most important vector, I can use a scientific term, to get the information to people to make the appropriate decision, whether it's to wear a mask, whether it's for social distancing, whether it's to have prudent policy, both policy at schools, at communities, all the way up to big public policy and the big global policy that Kate's speaking about. So that's really what we've been focusing on. the other part I'll mention which I think is a component that is often forgotten is who we are connected to individually. Are we connected in our community? Are we connected in a faith-based group? Or most of us actually have a workplace. So we've begun to focus on the workplace and the employer, and that's why Business Partners to Convince has come forward with some key core principles that are based in trust, transparency, truth, and listening to people's needs, understanding the sentiment that they might have toward health in general, or knowledge they might have toward health or vaccines in general, how they can get the information from the local sources, but that are based in fact, so public health guidance, how we can promote the vaccine literacy, how we can encourage the uptake, advocate for the accessible part. And I think that's a big key that Kate was saying. And even as we heard earlier, the letters that we give, the letters, the variants, the terminology we use, we can confuse people. So we have to make it equitable both in information and in resources. And then finally, this engagement that includes schools, includes parents, it includes public health leaders at all levels. So I'm hopeful that while we're continue to have data, and the KFF, I know Josh is going to speak about that. Molly and Brody did a great presentation yesterday that we saw, the National Foundation for Infectious Disease and other groups that continue to talk about these issues. Data continues to point to the same problem at hand, and it's up to all of us to have creative, innovative communication that is not just the message, but is also the dosage. We need to have the message over and over again that is based in science and fact. And frankly, I'm concerned, even when we talk about the vaccine, and Kate well said there's potentially 5 vaccines that are by competent authorities approved. There will be more. And these are not mix and match. And we have to be really careful about even how we communicate on those issues too. So we'll come back to it, but I hope that answers the question. And praises Josh's great work that KFF continues to do on surveying the American population.
Scott, you're doing a great job of teeing up my next speaker for me. Thank you so much, Josh. Obviously, the Kaiser Family Foundation has been gathering data during this whole past year about all kinds of aspects of the pandemic. Is there data that you can share with us about attitudes toward vaccination or attitudes toward the distribution and logistics, the gaps regarding vaccine?
Yeah, sure. And thanks, Scott and Maren and the others. Just building on what's already been said, I think, the data that KFF has through its vaccine monitor polling effort really amplifies the messages that you've already been hearing. You've already heard from the other panelists. So for example, I think it's important to realize that, overall, the main issue, both in the United States and globally, is this lack of supply. So we haven't yet met the demand, even close to it anywhere yet. And so that's the main frame that we're talking about. So when people talk about vaccine and whether willingness to take a vaccine, it's often, a theoretical exercise because they don't have access to the vaccine yet. And what we've seen in the United States is that earlier on last year, there were attitudes which were fairly, I'd say, high levels of hesitancy about the vaccine in a theoretical context. But once we had information about how effective these vaccines were, once they actually started rolling out, what we've seen is actual increases across the board in all kinds of population groups in interest in getting the vaccine. Now, when you look at the data at the US overall, 33% of the US population still says that they will definitely not get the vaccine, or they will only do so if they are required to do for their work or for school. So that's a fairly large proportion of the US population. If that's true, we are dangerously close to that herd immunity level if we're unable to vaccinate 33% of the population. That it makes the public health effort that much more complicated. But I also think it's worth sort of understanding more beyond just the surface level. And so we looked at different population groups, so subgroups within the US population. Racial and ethnic minorities have different views of the vaccine than the white population. There's more hesitancy in general in these minority populations, and there are specific concerns that these vaccines, being new, being proven before, that they are concerned about the safety of these vaccines, about side effects. And so those are the kinds of concerns within subgroups that it would be helpful to know more about within the local context of everyone who's out there in the seminar, in order to be able to address and create and craft those messages and communication efforts to address those things. So the other thing I wanted to say was that, the early indications are that in the US, one thing we had been concerned about is that there would be inequitable distribution of the vaccine. And at least from the limited data that we have in the early vaccine rollout, there's some red flags there in terms of access for racial and ethnic minorities, say, to vaccines. So when you compare the percent of, say, the Black population in many states to the percent of the burden of disease carried by the Black population in those states, there's quite a discrepancy there. So it requires active efforts that so far haven't been mounted to a great extent in the United States, but I hope and expect there to be more efforts to try and connect with different population groups and address their concerns along the lines that Scott and others were talking about.
Thank you all so much for answering those questions. There's a question that's been voiced by a number of people who are watching this webinar that I think is relevant to sort of both buckets of topics that we're talking about. So I'm going to reframe it for all of you. And it's the question of mobile populations in a variety of ways, whether that's people who are in areas where borders are relatively porous, such as parts of South America, whether it's places like the southern border of the United States where people may live in Mexico and cross into the United States for work, or whether they are actually migrant populations, such as in sub-Saharan Africa moving north. How do we reach populations such as those with vaccine in an equitable manner? And also how, if people are not, if they are, if not exactly stateless, then on the move in some manner, how do we create data networks that communicate to them about what the most important things are that they need to know? And I think I'll go to Kate first with this question of how is our logistics and distribution going to be managed for more mobile populations?
Well, I think one of the things to remember is, when we look at sort of the global immunization system, what I mean by that, I don't mean at the top level. I mean, when you look around the world at communities around the world, we've been doing vaccination of mobile populations for decades. So in fact, there's a little bit of a sort of curious thing that maybe that we might put our finger on here, that some of the low-income countries and low-middle-income countries have a lot more experience of doing a vaccine rollout, and especially rolling out to challenging populations than some of the high-income countries do. We've done actually hundreds of vaccine introductions in the past couple of decades in low-income and low-middle-income countries. And so there's really a deep experience of this. The way that mobile populations that are marginalized, certainly in fragile, vulnerable, conflict settings, these communities that are the least taken care of, the most vulnerable communities, what is so essential in assuring that we can get the services that they most need, and they are the most left out often for services, is to identify the leaders that are in those communities and to work really hand in glove with them for what it is they need, when they need it, and what comes along with it. When we come with interventions that are single interventions, it's not the most effective way of instilling the confidence. And so really coming with interventions that matter to the community, and they may include the vaccines that we are feeling are a priority, but they often have other priorities as well. And so when we bundle, when we integrate, when we come with something that those communities really want, that's when it's most effective. The second thing to say is that no one government, no one agency can do this alone. This is very much about the partnership of local community service organizations, local organizations that have the trust of the community, and of assuring that we have every partner, every community organization, every NGO that has the ability to deliver something that's helpful and putting their oar in the water and sort of being in the boat and rowing in the same direction. So it's really about partnership, it's about integration, and it's about local leadership and local planning. Those would be the three things that I would sort of focus on. Thanks.
It's really extraordinary over the course of today how often we have heard reinforced that there is particular knowledge in the Global South about rolling vaccine out across communities that the industrialized West could really learn from, that this is not at all a question of information or vaccine flowing in just one way. Claire, I want to ask you this question of mobile or marginalized or difficult to reach populations. This is an important concern in the United States for people who are undocumented, for people who are unhoused, for people who may not be participating in sort of standard networks of information distribution. Do you have any thoughts from your members about approaching these particular challenges?
Yes, and I agree with everything that that Kate just said. It takes a lot of different strategies and a lot of different communities. I think twofold is that we need to make the vaccine accessible, so we need to make sure that we're getting it to these communities. We have public health has some experience with doing this with hepatitis A vaccine, doing strike teams and going into communities. But the other piece is, as Josh alluded to, is building this trust and having communities that are actually giving testimony to the vaccine and value to the vaccine. And so, I mean, the good news with the vaccine is that it is free. It is, there are no strings attached to who can get it. There are no residency strings. There are no citizenship strings. But at the same time, it's going to be quite challenging to convince people of that and to have that trust built. And also right now, where we are, the limited supply is really pressuring the governors, and we see politics getting involved in where the vaccine is going or who it's accessible to. And so this rush to be efficient and to look good that we're getting vaccine into arms, we can't allow that to lose sight of equity. So, I think it's making the vaccine accessible, it's getting it to these communities, and it's also, building the trust and the engagement and listening in these communities now. Some of that is going on. Some resources have been devoted to that recently with states and public health, and there's a number of resources being provided into community organizations for this. But hopefully the supply will reach a point where we can focus more on that and not just on this efficiency and trying to get a percentage of doses into arms within a certain amount of time, because that really takes away from these efforts to ensure equity. So I hope things will we'll really be able to focus on that and use these resources with communities to build that trust.
Thank you. So I want to flip back to Josh and Scott to talk for a moment first about a problem that is really obsessing all the people who have been covering this, and certainly everyone who's on our live stream right now, which is the problem of combating mis and disinformation. And as the vaccine rolls out irregularly across the globe, rumor is getting in front of it. And so I would really like to hear if you have any particular wisdom about what our largely journalist audience should be doing as they tackle this problem of mis and disinformation, specifically with regard to vaccine distribution. Josh, can you start us off?
Yeah, I think Scott would have a lot to say about this. But just to start off, I mean, I think that, one thing that public health has learned is that when you're trying to combat misinformation and disinformation, I mean, it helps to have a clear message that is being transmitted from all levels of authority in relation to, say, a vaccine. What are the bottom line points that the public needs to know about this vaccine? And are there authoritative voices at, in the US, at the federal, at the state, at the local level that are mirroring those messages, and are the communication channels to get that message to the people who need to hear it out there? There's a whole another question about sort of the online and social media aspect to misinformation, disinformation that requires perhaps some more active measures, whether it's on the part of the government or other organizations to actively combat the efforts to frame the vaccine in certain ways that aren't based in reality, or to have some kind of ulterior motive about the vaccines that you need to actively combat. So there's multiple arms here. And speaking from the US perspective, I think the communications piece around the vaccine and has suffered in the past year, but I think we're trying to right that, and with more active efforts on the federal government. And now that we're expanding eligibility to more and more of the population, it becomes even more important to have those messages to combat the misinformation and disinformation that's out there. So I'll stop there and let Scott take over and others.
So Scott, let me just lob this to you. Just in the past couple of days, we've seen some reporting that misinformation and disinformation about the vaccines is actually being weaponized by certain governments in order to make the products of their nation's vaccine products more attractive in the global marketplace than others. So this is not obviously just well-intentioned people bringing what they've heard to their local networks. This is internationally organized, and it seems it would require some sort of internationally organized effort to combat. So what are your thoughts about how to make the combating of mis and disinformation as big as the problem itself?
Sure. Well, great question, Maren. And you're right. Some of this is state-sponsored, and some of this is organic amongst people with ideological beliefs, some of whom are well based in some evidence that they believe is true, and others that are off the limits, if I could say that, the flat earthers and so forth. But for the most part, there are some legitimate concerns that we need to address, and we don't need to address them just head on. We need to address them by having the same volume with the proper information and the accurate information, what we know as facts and truths that are put forward. And journalists, while I might be trained that there are both sides of an issue, when the preponderance of evidence is 99.9x% versus a very low percentage, that doesn't mean they have to have equal column inches in the old days or whatever it might be in terms of number of characters. So we've been calling for the need for an authoritative source. And last year in March, we wrote a piece for the National Academies of Medicine in the United States that we needed a COVID-19 news bureau. This was just early on. Now I think we need a COVID-19 vaccine information bureau that's not just sponsored by a pharmaceutical company or a competent authority as a regulator, but a group that would be able to put this understandable and digestible in ways that we could combat the misinformation with the facts that are out there and the evidence that has got these vaccines approved. But I'll even go one step further, that now that you mentioned, Maren, an international idea. Why don't we come up with a code of health communication or some sort of standards of practice for how we cover COVID vaccination or even COVID in generally? So we have evidence-based information, we challenge the misinformation, and we also encourage the media intermediaries to promote vaccine literacy. We can do this, first of all, whether it's Facebook and some of these other groups. Yes, they take down some stuff, but they still have these, I call these gated cyber communities of anti-vaxxers and others that are talking amongst themselves, oftentimes promulgating the misinformation that you've highlighted earlier. So I think we need to have a much better public-private partnership that could bring the standards up, that groups could follow, and that journalists and others, as you've been doing so well here today, will ethically advance. It's not going to be easy. standards and codes are usually, self-driven and professional bodies, but why don't we do that now? There's no time that's more important to have ethics in health communication, particularly around COVID.
Our live transmission live stream is lighting up at your suggestion. So we are getting close to the end of our session time, and here's what I'd like to do. We're going to do a sort of lightning round. You can have about a minute or two each, in which I'd like to hear each of you speak to the primarily journalists listening to this session about what your top concerns are with regard to your particular piece of this challenge of distribution and logistics that we've been talking about, and what you think journalists going forward in the next months should be most alert to. What's most important to you to see them cover as we all tackle this global challenge together. And Kate, I'll start with you.
Great. I think what we really have to focus on as we go forward here is about what is counterproductive and what is self-defeating if we're not actually seeing all of the players that need to contribute to assuring that there is even equitable access for all countries around the world. I think we really do have to understand who's doing what are the behaviors that are either enforcing and reinforcing what we've said is the right thing to do, both scientifically, economically, epidemiologically, and really ask people to act on that. And that includes individuals and countries and manufacturers and funders and banks and they're all the entities involved here. And if we need to act as one, then I think we need to address what those behaviors are.
Thank you. Josh, I'll go to you next. Things you're most concerned about as we look at distribution over the next year, I guess, and what you would like journalists to be most attentive to as these challenges roll out.
Yeah, I think that over this sort of medium term, the supply issue is going to be the major bottleneck here, and therefore, when you have a limited supply, it brings into question how countries, governments, state and local governments prioritize the use of those vaccines. Something that Kate had talked about before, something that Claire had talked about before. But I think it's incredibly important seeing the rollout in the United States and also other countries, the contentious nature of deciding who gets these limited doses of the vaccines, making sure that the policy is well thought out, that there is, some effort to really operationalize what can be a piece of paper outlining what they think the priority groups are. Making it happen in reality is a lot more complicated than just saying what it's going to be. And so paying close attention to how your particular government, who's in charge of deciding prioritization, what they're deciding, how they're doing it, is going to be a really big part of this story. Are they effectively able to balance this question of getting the vaccine that they have out quickly with addressing the equity concerns that we're also concerned about? So I'll stop there.
Clara, I'll go to you next. As you look over the landscape of vaccine logistics and vaccine distribution over this next year, what are you most concerned about? What frustrations are you seeing? And what are the things that you would like journalists to be most alert to as they cover this situation?
Thanks. Yeah, I mean, I guess my concern is that, there are data markers or, what have you showing how we're doing really don't give the picture of how we're doing. And so we need to make sure we look a little deeper and, looking at where states are doing things well, in the US is really not just around, getting the most people in line to give people the quickest vaccine. It's really more about making sure that we're getting vaccine to the right people, we're communicating it well. We have systems in place to to manage demand and assure people, that they will get the vaccine when it's their turn, that type of thing. And I think some states are doing that in a better way than others. But I think it's critical that the communication and the messaging and the information that we give to the public presents a picture of what's happening, but also reassurance that what's happening today at this second is really not the whole big picture. I guess I mean that getting the vaccine into arms as quickly as possible isn't the solution for the long term. We really need to look at equity. We need to look at making sure people understand the communication, the value of the vaccine, the trust in the system. And we are on a route to get vaccine to every person that wants it. So if you don't get it today, there's tomorrow, there's next week. And focusing on some of the bigger picture messaging, the trust, the value of the vaccine, and not just on whatever the event is of the day.
Thank you so much. Scott, I'll ask you to be our last commenter. The things that you're most concerned about or that you see sparking the biggest frustrations as we look ahead, and what you'd like journalists to be most alert to as they cover these challenges.
Okay, thank you, Marian, and thank you for this great discussion. So I'm trained as a public health physician, and I'm a big believer in government and others working together. I mean, my last position before CUNY was at Harvard Kennedy School in the Center for Business and Government, all about multi-sectoral engagement. And what I get concerned about is we think of equality of voice, and we need the experts to help when it's appropriate. So public health physicians and people in the public health field that are trained in ways of getting the vaccine from the vial to the public are a different training than people who are discovering vaccines and getting through regulatory processes. Similarly, all of us that are looking at this pandemic might be looking at the elephant differently. It's up to the journalist, and it's a great burden, if I can say that positively, an ethical burden to try to paint the picture that's appropriate of the reality of society. So I think this will be an iterative process. Right now, we have a lower supply of vaccine than the demand. At some point, we're going to have more vaccines, and then we're going to have to address the people that are hesitant and are not willing to get to a vaccine. Getting to 50% of the world's population is going to be much easier than getting from 50 to 80%, which is the herd immunity that will be necessary. The first part of the challenge is getting the supply and getting it appropriately there. The next part of the challenge are the hearts and minds of individuals. We need to think of this in the long run, and I would hope that everybody is getting the right sources that they can go back to that are trustworthy, and continue to build upon the sources with other multiple sectors of society. What makes me worry at night is if I see the same people, sometimes with the same blinders on, if I could say, or not seeing the whole picture, we're going to be in a position that we don't want to be in. We need equity, we need access, and it's very different what might happen where our school is based in Harlem and in New York City than it's going to be in other parts of the world. But nonetheless, the whole ethical component of what we need to do and get truth and transparency and trust out there is incumbent upon all of us. So I hope that I put some ideas out there. I'll give the final plug to the Journal of Health Communication that we have next month, because we actually have about 20 different perspectives on how to address this, from trust in sources to developing messages to other policy and other ideas. I'll put that in the chat and it'll be open source and available for others to see. So thank you very much.
Thank you, Scott. And thank you to this fantastic panel. Thank you for spending time with us here in Zoom and on this live stream watched by journalists around the world. I think the messages of the entire morning have been equity, access, transparency, respect for culture, and for those of us who are journalists in the audience, being careful to choose the right and most responsible sources. You'll be able to learn more about this if you like, and to continue this conversation in the massive open online course that the Knight Center, the first sponsors of this webinar, along with the WHO and UNESCO, will be launching in March, where we'll be talking over a month about the vast challenges of vaccine science, logistics, and distribution around the world. We hope you'll join us there. I'm going to end the panel portion of the webinar now, and Mallory Tenori of the Knight Center will come back to close us out. Thank you all around the world for being with us. Stay safe.
Great. Thank you so much, Maren. Wow, this has been such an informative and enlightening series of conversations. And we've had people joining us from throughout the world, making this really a truly global webinar. I've learned so much from hearing our panelists talk, and I hope that you have too. I want to say thank you again to you, Maren McKenna, for your wonderful moderation, and to all of our speakers. You are all fantastic, truly. And I want to thank everyone who helped out behind the scenes, our interpreters, the Veritas group, the Knight Center team, and so many others. And I want to thank our wonderful partners. So this webinar was held by the Knight Center for Journalism in the Americas at the University of Texas at Austin in partnership with UNESCO and the World Health Organization and with funding from the European Union. And as we mentioned earlier in the webinar, and as Maren just noted, we are going to be having a MOOC that will focus on helping journalists cover the vaccines. So we do hope that you will stay tuned for more information about that. Registration will be opening up next month in February, and more details will be on journalismcourses.org. So we will keep you posted on that. So on behalf of the Knight Center, I am grateful to all the journalists and the media practitioners who joined us here today. Keep up the good work, stay safe, and take care.